gbà ṣé bá ṣe ń pè wá nìyẹn àwọn tí wọ́n fún wa ní ìròyìn bí gbogbo nǹkan ṣe ń lọ ní ìpínlẹ̀ Ògùn state àti ní orílẹ̀-èdè Nàìjíríà. In fact gbogbo àgbáláyé náà ni ṣé mo gbà á? Okay, so without wasting much of our time, I want to first and foremost appreciate every one of us there present for honoring our invitation out of your tight schedule. For honoring our invitation, we appreciate you. So we will start with an opening prayer. We understand that every one of us is busy. We got an information not quite long that majority of the media that they are in an engagement with the inspector of police. So I think when we have that information earlier, we would have sort of shift hours, probably do it in the afternoon or find a much more convenient day. But notwithstanding, we are achievers and we believe that we will achieve success by the special grace of God. So we are starting with an opening prayer, and that will be our national anthem. I will hand over the mic to the State Immunization Officer, Mrs. Faneye Adebisi. Emma Oshayeni. Ẹ̀wá ṣe àwọn èèyàn náà lójókòó yìí, wọ́n bá wọn kárí ìyá ṣe pẹ̀lú wọn. Adé ní àṣeyọrí pẹ̀lú ògbóró.
Let's recite the first stanza of the national anthem. Nigeria, our own native land, no tribe and tongue may divide, in brotherhood we stand. Nigerians all are proud to serve our sovereign motherland. Ìṣẹ̀yà, ìṣẹ̀yà, ọmọ Ògùn, ìṣẹ̀yà, Elédùmarè, iṣẹ́ máa yá o. Ìṣẹ̀yà, ẹ̀yin ọmọ Ògùn, ẹ ṣe gírí, iṣẹ́ pọ̀ fún wa láti ṣe. Ọmọ rere kì í ṣaṣẹ́, ọmọ Ògùn kì í ṣọ̀lẹ. Ẹ bẹ̀rẹ̀ gbẹ́rù o, Ọlọ́run ń bẹ fún wa, ẹ tẹra mọ́ṣẹ́ o. Ìṣẹ̀yà ọmọ Ògùn, ìṣẹ̀yà. Thank you, everybody. Let's have our seat. The next thing is some introduction. You tell us your name, the radio station you are working with. Thank you.
Good morning, everyone. My name is Mariam Ogunremi. I am the head of program /1617. Thank you.
Good morning. My name is Bola Tifia Olawumi from Platform News.
Good morning, everyone. My name is Yemisi Shuripo, and I work with OGUN.
Good morning, everyone. My name is Ajara Malefa from Street 107 from Abeokuta.
I'm Dr. Diaga from Health Promotion Unit, Public Health Department, State Ministry of Health. I'm representing Dr. Mrs. Motoju, that is on our way to Thank you.
Good morning, everyone. I'm China Islamia of the State Festival. Good morning, everyone. It was once again, I'm China Islamia at the State. I would like to first of all appreciate each other to make today. I think we mobilized about 20 year personnel, but we made do with what we have. For some of us, I'm sure you are conversant with what we do all year round. We go out into the communities, into the schools to distribute medicines, targeting some particular diseases. So, but for this particular round, we'll be having a school-based deworming exercise that's targeting 10 across 10 local governments, and we'll be distributing some medicines as usual. So we are calling on each and every one of us. We are seeking for your support. We are help. We don't want to say, because this is not the first time we are having it. This is like the 6th, 17th, 20th round, and take us for granted. No, every round has a unique characteristic, and we must not be found wanting. And that's why we don't leave any stone unturned to do the needful. Earlier this week, we had a stakeholders meeting with, maybe the traditional leaders, the religious leaders, the other and the likes. So that's why we are calling our esteemed media personnel again today to seek your support in having a wonderful exercise. You see us reaching out. I'm sure some of us, almost all of us, are on that media page, NTD media page. You see us reaching out to us once in a while with respect to helping us create awareness as per our activities. We continue to do that, and we are hoping and looking forward to your support. Once again, you're welcome to the NTD Control Program Media Party. Thank you.
So the next thing on our agenda is the remark from the partner. Mr. Emmanuel.
So, on behalf of Management and Leadership of Evidence Action, representing the country director, the person on pharmacy Stockwell, and also the Southwest Zone, person on Maria Lele, I want to say a big welcome to you all, and thank you for taking time to attend this media panel. For us as partner and as a collaborator in the health intervention in the states, we look forward to a time where we will be able to work as strategic information managers in disseminating information to help us get key buy-in and support as we roll out our activities at the states, LGA, and world level. The work we're doing. So once again, thank you for coming. I look forward to fruitful collaboration. Thank you so much.
Thank you. So the next thing on our agenda is overview of NTD program in Ogun State.
Mrs. Mariam, overview of NTD program.
So good morning, my name is NTDs. I'm presenting on behalf of my brief overview of NTD program in Ogun State, specifically schizophreniasis and soil transmitted disease of metiasis program in the state. Here we can see the example of yes, this is urine in blood. These are what we can find there. This is what we see our children at times passing out in their urine at their various schools. This is an example of children suffering from schizophreniasis, whereby they urinate blood in their urine. Also, these are examples of soil-transmitted diseases. These are serious. We'll still talk on most of these things as we continue. The strategic goal of the state is to make sure that NTD program progressively reduces morbidity, disability, mortality due to NTDs using integrated and cost in the state. We have those at the community level. We have those which we think at the state, at the school level, and those are the two specific. Those are the two specific levels at which we do our treatment. Onchocerciasis. For onco, that is when we find people actually itching their body. It is caused by what we call emokuru. It is by what we call emokuru. It is black fly, to be there, a little bit bigger than mosquito. And what it does is you find people scratching their body all the time. And you see find people whereby blood will be coming out from their body, and they will still be trying because it feels somehow they enjoy it, and it also causes blindness. That is for onchocerciasis. And also under this community treatment, treatment of wellness, which is the hepatic filariasis, and then you see people suffering from elephantiasis. Thereby, you see the lower part of their leg getting very enlarged. You see some also having their hands enlarged. You have some, they have bigger breasts, one even bigger than the other. And we have such symptoms a lot for those having lymphatic filariasis. You see some will call something hydrosis impact. That one is also caused by moving into what we call schistosomiasis and so. The big objective of NTD program in the state, number one, is to ensure high level of awareness and increase support for neglected tropical diseases. Actually, that is why you are here this morning, because we actually need you to help us in creating awareness among the populace. This is actually your area of specialty, and we hope that you help us in doing this today. Also, to enlighten the populace on the burden of NTDs in the state and help improve medicine uptake during subsequent rounds of mass administration of medicine, thereby reducing the burden of NTDs in our dear state. The third one is to build capacity with the aim of addressing specific weaknesses, challenges, and improve quality of life control implementation. And the last one is to improve quality of NTD control implementation towards achieving maximum therapeutic and geographic coverage. The truth is, as we go to the field to treat, there is a specific target that we actually look out for. That is to make sure that yes, we achieve the reason for the treatment. Now, we have classes of NTDs, I've said it before. For the classes of preventive chemotherapy NTDs, when we say preventive chemotherapy, the first thing when we talk about chemotherapy, we mean treating by distributing medicine. That means we give everybody that is eligible the right dose of medicine so as to treat for the particular disease. Now, for preventive chemotherapy, we have for onchocerciasis, which we call river blindness. It causes blindness at the end of the day, and it is caused by black fly. We talked about inon. The second one is hepatic filariasis. That is what we call ibuse. At the end, I think maybe we would have seen some people with very large limbs. As a woman to be gone. Although any to nepa, when I talk about it, I know most of us know about hydrocele. It also causes hydrocele. And the truth is, these people go through a lot. mo mọ̀ pé kò sí ẹni tó máa nípa tó máa bọ́ síta pé wá wò gbóhùn nípa. It does not work like that. Most people will not come out. So that is why they say they suffer in silence. Ẹni tí with very large lips, even tó bá tàn kọ́, if someone like that should start selling something outside here, most of us will not buy it. The next thing is just for Allah to fi kakora kúrò, and that it causes a lot of stigmatization. Those are just for the community-based treatment. The next one, the two that we are actually looking towards, that we look at today is schistosomiasis, which is called snail fever, and soil transmitted ehrlichiasis. Okay, schistosomiasis, I showed you something the other time on the slide where we saw blood inside a small tube. And this is what happens. Once a child has schistosomiasis, that child urinates blood. Every time he or she goes to anywhere he wants to urinate, you see blood constantly, because that person, male or female, constantly passing out blood. Also, we know the effect of passing out blood. Fún àwọn obìnrin kan tó jẹ́ pé maybe every month they have to do passing blood every time he or she goes to urinate. Normally, it affects a lot of things. It affects the cognitive system, it affects the thinking. Tí ẹ̀jẹ̀ ò bá tó gan, we know what actually happened. And at the end of the day, we know that such child will not be able to think properly in school. The next one is soil transmitted ehrlichiasis, which we all know the general arm. And what I always say, under NTD, we say feed the child and not the worm. Because what happens at the end of the day is the digested food that the body should use for key activities. You know, there are stages in life, nígbà tó mọ́ ṣe kàwé, that child actually needs nutrients. Láti fi ṣe kíni, láti fi ronú. And what such child does not have such nutrients, at that particular period, it affects a lot of things. And you see such children who kàwé kò ṣe kíni kò yé, he or she cannot actually assimilate properly. At the end of the day, we start having problem, ọmọ sákúrò nílé ìwé, ọmọ di ìkíni oríṣiríṣi. And that is what we are actually trying to prevent this by actually deworming our children. Tí bá ní pé ká lọ́wọ́ sí pé ẹni mélòó ló ti deworm ló wà lọ́dún. Hello ma. Ẹgbẹ́ ló ti deworm lọ́dún. Let's go for ourselves. That is one tó ti deworm ní o. Ẹni mélòó ló ti deworm ọmọ ẹ̀ lọ́dún. That you actually went to the lateral deworming, and you know the importance. Now the truth is, Tabako 100 sílẹ̀. That's you are looking at 100%. Tabako 100 sílẹ̀. I will tell you that. Man want to carry that they are even airlines where I'm marry 15% that actually deworm. And this deworming is only in Ogun State. It's not only in Ogun State. It's only in Nigeria. Even some countries like India knows the importance of actually deworming children at this age of actually this 5 to 14, because that is the period you become whoever you want to become, and that is the period you are able to think, you are able to ask, you are able to develop your cognitive system, your brain system, and they know that it is very important. But the family èèyàn ní ìkọ̀kọ̀, let's assist them. Káwọn ọmọ náà kọ́ ṣe kí ni o, kí wọ́n dàgbà. Káwọn náà dẹ̀ jẹ́ èèyàn lọ́jọ́ ọ̀la. Now because I have to know, because let's look at this schistosomiasis and let's see. I said schistosomiasis is an acute or chronic parasitic disease caused by dermatose worm schistosoma. Now let's see, infection is, let me just move fast here. Now the thing with schistosomiasis is, I said the person tó bá ní schistosomiasis ló máa ń tọ ètò ẹ̀jẹ̀. Àtọ̀ tó ẹ̀jẹ̀. Now for schistosomiasis, what is the how do we actually get infected? Wherever we have an infected flowing river or body of water, let me put it that way. When we pass through it, ẹ mọ̀ pé àwọn ọmọ kò sí tó kàn wọ́n, wọ́n bá rómi. Nítorí àgbàlagbà ń gbà mí, you see water, you feel like kí n gbẹ́sẹ̀ sí omi. We know what we did when we are young. Kò sí ni you want to Then àwọn mi wà tẹ́ pé when we are young àti mú wọn lọ sí ilé wọ́n ti gbé àwọn lọ sí abúlé, they actually like swimming. Students, this is what we do a lot. And when we do this, most of the time, most of our children get infected with most of this. We go to some areas wọ́n ti tọ́ ọmọ bá ti ń tọ ètò ẹ̀jẹ̀. That is the period tí ọmọ ṣẹ̀ṣẹ̀ wọ puberty is becoming a man or a real woman. That is their words, their thinking. And we have to change that. We have to really educate them that this thing at the end of the day kills. Number one, that schistosomiasis at the end of the day, what we call female genital schistosomiasis, and this actually affects the female. At the end of the day, they have problems with their reproductive organ, they cannot give birth, they have a lot of other issues that is, they will not even think that maybe we are putting lots of doing back. And these are some of the things that they actually suffer from. Àwọn ọmọ òde so they don't tell their parents wọ́n á kọ́ sàṣírí olè náà máa lọ tọ̀ wọ́n ní jẹ́ kọ́ mọ̀ pàtó bá ń tọ̀ fáwọn ṣe kí ni o àwọn tọ́tù ẹ̀jẹ̀. And then when parents mi ò lè mọ̀ wọn ò ní mọ̀ pé olùkọ́ bẹ́ẹ̀ yẹn ló ń ṣe ọmọ wọn. You are soliciting for your support. We know we cannot do it alone, you cannot do it alone, and that is why we actually need you. They say symptoms include abdominal pain, diarrhea, blood between your throat, anemia, painful and frequent urination, liver or spleen. You see, when I start to write on someone's salary, I start getting afraid. And that is when you see liver or spleen enlargement, disability. We have renal failure, stigmatization, and social consequences. Now, we'll talk a little about this stigmatization. Come on, to one talk to you should be okay, but that to STI. And at the end of the day, about daily occur, the things which is an infection. And he or she might actually lose her life. Work at the end of the day, and then there are a lot of other issues associated with it. Now, the second one is general harm. We have a comparison of which are primarily one, weak one, or weak one. We did impact assessment the last time, and the truth is, we see how this disease is among us, among our children. We went to one area near Yewa. Most of our children test there, only hookworm. And hookworm are a little bit afraid of hookworm. So by day, you test it hooks the intestine. And what it does is, as they are eating, as the food is getting digested, it is absorbing that food. And the process is even lot on board, and I think about hook, then that child also pass out urine, pass out blood. You see symptoms of blood also. It's one of the deadliest. You have also put arrow. I think arrow is so simple. They are one of the deadliest diseases that affect our children, that actually targets our children. Unfortunately, àwọn ọmọ wa ló máa jẹ́ pàánù wọ́n máa bọ́ sísàlẹ̀ jọ pé wọ́n máa fẹsẹ̀ rẹ̀ láì wọ bàtà. It can actually pierce the skin fún ìwọ̀nù ara wọn. And although fáwọn àgbàlagbà àtúpọ̀ àkọ́kọ́ máa ń lo oògùn ara rẹ̀ fáwọn around it. Àyẹ̀fọ́ wa, our vegetables we don't wash properly, we see these eggs and we eat it and we swallow and a lot of things. Ọmọ ẹ̀kọ́ náà ló máa dé orí rọ́ọ̀gì ló máa fi ẹsẹ̀ yígbẹ́ sórí rọ́ọ̀gì. Ọmọ náà ló máa fọwọ́ ha rọ́ọ̀gì náà ló máa with that, and develop. It's very important that our children actually develop and they are treated. Let's move because of our time. Why should we take it seriously? These diseases affect human health and lead to reduce productivity. Ọmọ tí ò lè ronú dáadáa, àyè tó bá yẹ sí náà ló máa ṣe. Because they too aspire, but because of some of these things, they don't actually achieve what they aspire to become in life. We say these are diseases of poverty, which are found among poor people living in rural areas. Let's help to also lift them up. We have these diseases, if untreated, could lead to disability, stigmatization, and death. I've said that. High dropout rate, absenteeism, and poor performance in schools are attributes to NTDs. NTDs at times don't kill, but what they do is even much more worse than killing. We have schistosomiasis and self-transmitted epilepsiasis can result in anemia, that is loss of blood. Now, let me leave this. So, for schisto and SCH endemism, we have schisto is, let me leave this also my time. So, we have different strategies of treatment. We have different strategies of medicine. Teachers, we also have strategies. Teachers, we also have strategies in which also will find way of also treating them, because not do is we tell children, students around that they can actually visit those schools to collect medicine. This medicine at the various health centers. At these health centers, they collect medicine, and we also make use of our frontline facility staff. What they do is to go to communities during, they go to markets, they go to churches. For those schools that will miss at schools, they can also treat them at those areas too. We have advocacy visit to identify stakeholders. We also have our stakeholders. We have continuous community sensitization and our God my beloved, God my beloved, because you say I'm here. They feel that this message, which is not so. So the medicine, and it is someone big in life. We have creation of awareness, we have adequate mobilization of teachers, continuous monitoring, use of school health workers in all schools where available, creating a fixed post in all the wards to cater for non-enrolled children and also manage any case of serious adverse effect. So this was the treatment that we did this year. Yes, number one is that this drug is free, this drug is safe. In terms of effectiveness, this drug is very, very effective. Based on what we have been hearing, okay, there's this picture of children actually passing out worms. You see children passing out worms. For children urinating blood, within the first 1 or 2 days, that is the truth. The first 1 day, not 2, that blood will cease. So the drug is very, very, very effective. Now I want to quickly show this because actually I can see it on my phone. Okay. Oh, I would have loved to actually present this. I think maybe they will also give us. We're actually going to 10 LGAs this time around. That's what I want to project it. I don't know. We're actually going to 10 LGAs. So for some of these LGAs, we'll only be treating based on the endemicity and treatment. There is one LG out of them which are very slow. That is Ijebu North. Ijebu North will only be using mebendazole, and that is the treatment of work. Then we have LGs that will be treating both mebendazole and praziquantel, and we have those that will only be using praziquantel only. So those are some of the LGs that will be treating. We are asking for your support. We know it is very important and it is very key. We want children that we can actually say, yes, these are our children, and that is what we are looking forward to. We can only achieve this through your support. So thank you, sir. Thank you, ma'am.
Thank you very much, Mr. Ademuyiwa, for your beautiful, explained presentation. Okay, so before I give us time to ask questions and to seek for clarification clarification, let me quickly summarize what Mr. Demuyiwa. Basically, in the Ogun State Neglected Tropical Control Disease Program, we handle 4 diseases. He has actually mentioned that 4 diseases. And these diseases, we can use medicines to prevent them, and at the same time, we can use medicines to treat them. And that is the English, the Oyinbo around preventive chemotherapy, neglected tropical diseases. I'm not many PC NTDs. I am very sure that by now, those of us seated here, you must understand what NTDs are. That's what NTD. N here, odrofun neglected. T, odrofun tropical. D, odrofun diseases. Neglected tropical disease. So these 4 diseases, briefly, it talked about schistosomiasis. In our area here, we understand schistosomiasis as atosiaja in our local dialects. He also talked about soil-transmitted helminthiasis, which is also known as Aroino. Onchocerciasis, which is also known as Inorun in Yoruba, and lymphatic filariasis, which can be Iwuse and Ipa. So these 4 diseases as organisms that transmit them. They have causative organisms that transmit them from one person to another. Àwọn àrùn yẹn wọ́n kò lè dédé ṣẹlẹ̀, wọ́n máa ń tara èèyàn kan bọ́ sára èèyàn kan. Màá ṣàlàyé fún wa ní ṣókí kó lè yé wa dáadáa. Fún àpẹẹrẹ, let me pick schistosomiasis, which is atosiaja. Atosiaja schistosomiasis can be contacted when we wade in the river, or we bathe in the river, or we have contact with contaminated water. Inú odò ni wọ́n ti máa ń kó atosiaja. Báwo ni wọ́n ṣe máa ń kó? Èèyàn kan ti wà tó ti ní atosiaja yìí tẹ́lẹ̀. Á wá lọ sódò. Bóyá níbi tó ti ń wẹ̀ mọ́, there was a time I was at one community, one of our highly endemic community, Shakojola, in other local governments. So we were asking questions among the residents there that, ṣé máa ń tọ̀ sínú odò ní wọ́n ṣé ìyàwó wà nínú odò ìtọ́ àwa gbọ̀n àwa kúrò nínú odò àwa bọ́sítà kó wọn fẹ́ lọ tà àwọn máa ń tọ̀ àwọn dẹ̀ máa ń yàgbẹ́ bẹ́ẹ̀. That same odò òun ni wọ́n mu. Inú odò yẹn gan náà òun ni wọ́n ti ń wẹ̀. Omi odò yẹn kan náà òun ni wọ́n fi ń wẹ ọmọ tuntun. Nífàtí kò sí ẹṣọ́ ọmọ tuntun nìkan, gbogbo àwọn ọmọ wọn òun ni wọ́n fi ń wẹ̀ wọ́n. Odò yẹn kan náà tó bá bímọ tán inú ẹ̀ ni wọ́n máa lọ ju kí ló ti ń pè placenta, kí ló máa pè placenta, ibi ọmọ inú ẹ̀ ni wọ́n á lọ jù sí. Bẹ́ẹ̀ ni odò yẹn kan oṣù yẹn náà ni o, inú ẹ̀ náà lọ ti ń pẹja. Odò yẹn kan oṣù náà ni inú ẹ̀ ni wọ́n ń sọ̀bẹ̀ sí. So all these diseases, they have to do with poor sanitation, poor hygiene, bad behavior, attitudinal behavior, bad or nonchalant attitude. They do not see their community. They believe it's a normal thing. That is schistosomiasis. So the person that has been infected enters the river, wade in the river, passes urine in the river, or passes feces in the river. And an unfortunate being, kọ́nà má jẹ́ àṣírí, ibi tádùúrà ti wọnú ẹ̀yìn yìí, tábà ti ń lọ láàárọ̀ lọ́sàn-án lájọ́ náà, ìjọba má jẹ́ àgbákò, àdúrà ńlá ni o. Àgbákò yẹn kì í ṣe pé bóyá kéèyàn lọ sí police station nìkan lọ́rọ̀ àgbákò. Ẹlòmíì náà máa ń kó àgbákò látara wípé ó kó àrùn tí ò tiẹ̀ mọ́wọ́ tí ò tiẹ̀ mẹsẹ̀. Kí má yàbàrà, ọkàn mi lọ sí ibi HIV síbò mi níyà lọ síbẹ̀, NTD nìkan tá à ń sọ lọ́wọ́. So ẹlòmíì tó wá wà unfortunate bí ẹ̀yẹ́ kò kó pé odò lélẹ̀ ìjàre jẹ́ kó ń refresh ara òun lòun bá lúwẹ̀ inú ẹ̀. Òun kàn lúwẹ̀ inú odò ní odò tẹ́ tó ti ní ṣíṣò tó ti yàgbẹ́ sí tó ti tọ̀ sí. Tí ẹni yẹn tó ti wọnú odò yẹn ó ní ìgbín kan. Bá ṣe ní causative organisms òun náà lá ní intermediate host. So ní ìgbín kan wọ́n máa pè ìgbín yẹn ní ìṣàwùrù. I will not go on with the biological term. Tàbá ti sọ pé bùlì ní ọ̀sán àwọn tó ṣe biology ọmọ àti understand it. Ìgbín yẹn ló máa wá mú ẹyin yẹn, ìyẹn ló máa gbà sára. Ó ń dúró de ta ló ń bọ̀ tó fi wá kágbà kó. Ọlọ́mọdé àkágbà kó. Tí ẹ bá ti rí pé èèyàn ti wọnú ẹ̀ báyìí, yẹn náà kọ́ release the miracidia ní ló bá tán. Once the person have little contact, kò ní ìdìbò bomi sára, kò ní ìdìbò lúwẹ̀, bó ti jẹ́ kọ́kọ́ ra tẹsẹ̀ bọ́ ní odò yẹn báyìí. Ó dẹ̀ ọ̀gbẹ́ jẹ́ tẹsẹ̀ bọ́ mẹ́jà rè jẹ́ ìjáde bí àwọn tó bá ń ṣe ìrìbọmi and the likes yẹn. We also need to be very careful regarding that. Because once we have that snail in that river, everybody that enter that, whether one person is there, whether one call of the person is at risk of schistosomiasis. So how do we know that someone has schistosomiasis? He has mentioned it. They will pass blood in their urine. One command to a and at times, we do see some people that did not pass blood in the urine, but they have the eggs in their blood. How do we be about this? Then you might say complain about symptoms. Already, for all these diseases, they usually come with feverish condition. And the people don't have ṣàánú tó fẹ́ tètè tó fẹ́ kí wọ́n tètè mọ̀ nǹkan tó ń ṣe. Ó lè ní fever rádà. Tó bá ti ní fìlà tó ní fọ́tí gbogbo ẹ̀ ń ṣe tó test ẹ̀. Okay, ṣe malaria test negative. Ṣe HIV kí la tún máa ṣe typhoid negative. Ṣe WIDA negative. Kí ló wá lè máa ṣe ní yo? Tó náà bá bẹ́ ní yẹn ṣe tó bá bẹ́ tó mọ̀ nípa iṣẹ́ wa yìí. But it is not everybody that understand what these diseases are. Even the medical practitioners, majority, because it was not all that mentioned in the medical swan, also in other medical professions like nurses. So we are just trying to incorporate all this into their curriculum so that they too they will know more about neglected tropical diseases. From the name neglected, àwọn àrùn táwọn èèyàn kọ bí ara sí ni neglected. So because ó ń ṣe àwọn èèyàn ní jàmbá and people can move around with it. Unlike malaria, unlike TB, tó jẹ́ pé tó bá ti ń kúkú àwùjọ máa ti wọ́n ó súnmọ́ bí ẹ̀yìn ti ní kọ́ ìfẹ́lẹ̀ àbí kọ́ whatever. Ṣó ti yẹn sìn? So now, schistosomiasis, if the person is fortunate and is being diagnosed by someone that has this knowledge about neglected tropical disease, madam or sir, ṣé kìí ṣe pé bóyá ní àwọn ìgbà kan sẹ́yìn ẹ ti ṣalábàápàdé odò ẹ ti gba odò kọjá àbí omi odò ti kàn yín lára? So if the answer is yes, ọlọ́run ti bẹ́ẹ̀ nìyẹn ṣé nìyẹn, they will ask the person to go and do test. Wọ́n ní kó lọ ṣe test fún schisto bí ẹni ní schisto, and when the sample is being taken and it is read under microscope ó máa gbé wá báyìí. If it is schistosoma hematobium wọ́n á sọ microscope ló máa sọ fún wa. If it is this other one masonite microscope ló máa sọ fún wa pé àìní yóò ti ní àtọ̀sí ajárí ẹ̀jẹ̀ kọ́ lè máa yọ nínú ètò ẹ̀yìn àbí ẹ̀jẹ̀ ti yọrí tí ò ti ẹ̀kọ́ yára sí tánádẹ̀ tó ti wá padà gbà mọ́ra tẹ́tìbọ̀ sẹ́yìn yẹn ó sì máa wà nínú ara ẹni yẹn. So that is that about schistosomiasis. Ó ń ṣọkùnrin, ó ń ṣobìnrin, ó ń ṣọmọdé, ó ń ṣe àgbàlagbà. For the female, kọ́nà ó ṣàánú fún wa, àwọn obìnrin ẹni ire ni wá ẹni yìí ni wá, but ara wa náà kò tún gba ìwọ̀sí tó. There is mentioned female genital schistosomiasis. For women that have contacted water bodies that have been infected with schistosomiasis in their lifetime, kò bá jẹ́ once, kò bá jẹ́ twice, kò bá jẹ́ kó bí àwọn lọ lójoojúmọ́, and they left the disease untreated in their body. They did not use praziquantel, they did not go for medical checkup. At the long run, the disease will enter their genital organs. And it can lead to infertility. It can lead to abortion. It can lead to what other thing? It can lead to having discharge. Discharge obìnrin oríṣiríṣi. There is normal discharge, there is abnormal discharge. So the abnormal discharge, if the discharge is not whitish, tó ti ń yellow, tàbí tó ti ń mú kọ́lọ̀ mi wá, bóyá bí green àbí nǹkan kan, àrùn ti dé nìyẹn, kọ́lọ̀ má fàìsàn ṣe wá. Tàbí ó tẹ̀lé wá rùn, obìnrin mi àkọjá ló máa gbá fí ni, perfume ni obìnrin mi fi ń gbéra. So irú àwọn obìnrin mi ò dẹ̀ lè rìn, bó ṣe kó ṣo, but kò lè rìn láì jẹ́ kó lo pad torí àwọn kan tó ń jáde lójú ara ẹ̀. So these people, we encourage them, we advise them to go for medical checkup. They might be feeling that ayé ló ń ṣe wọ́n. In most of these diseases, Yoruba believe that it is a cause from the witches and the wizards. Their what is it called? Ìyálé ìyá wọn, orogún ìyá wọn, òun ló ń ṣe wọn, òun yóò ní ìyá tó jókòó jẹ́jẹ́ ara wọn. Because it has to do with infertility. The person has been married for 10-15 years ago, no conception, kò lóyún ní, tàbó tẹ̀ tí wá lóyún ni bó ṣe ní tó bá ti kóṣù mẹ́ta ló ń jábọ́. Wọ́n ti àtàṣe mọ́ yóò ní ìyá tó jókòó jẹ́jẹ́ ara bí ọkọ̀ tó kọ̀ ṣe mistake tó ràn jù mọ́ wọn lójú tó ràn mọ́ yẹn òun ló jẹ́ kóyún. So all these signs have told us that they have causes. They have causes. So that can be as a result of the contact that the woman has already had with contaminated water. So that is for schistosomiasis. Men too also have male genital schisto. Ìṣe kó bí àwọn ọkùnrin náà ò ní o, but ọkùnrin ṣe mọ̀ kò ní hàn bí títí obìnrin. Ara obìnrin ibi tó open ni, ojú ara obìnrin ibi tó open ni tó jẹ́ pé kò fàyè sílẹ̀ fún ojú ìdèwé. Some will even do it at the backyard of their houses, and at the long run, children that they are playful, they will go there, they will match the feces. So the feces we mix with the soil, and the soil will be contaminated. So whoever, probably the children, most times adults do not pick biscuits or whatever that drop on the floor, but children pick it up, they will rub it with their clothes or rub it with their hand, and they will eat it again. And the biscuit has already been contaminated due to the contamination of the soil. Or they can walk barefooted. Children that walk barefooted too, they are also liable to contact soil transmitted illness. When we talk about hookworm, it might penetrate skin warning. So àwọn ibi tí wọ́n ti ń kó àrùn nìyẹn. Or either adults or children that use the restroom, wọ́n lọ lo ilé ìgbọ̀nsẹ̀, wọ́n ṣe ìgbọ̀nsẹ̀ tán, wọ́n fọ́ wọn pẹ̀lú ọṣẹ àtomi. Ọwọ́ yẹn kan náà ni wọ́n fi rí apple nínú fridge. Wọ́n fi ṣí fridge, wọ́n fi mú apple, wọ́n ṣan apple kan wọ́n jẹ. So the person has eaten feces with the apple. There is something we call fecohora. Wọ́n ti jẹ ìgbẹ́ mọ́ oúnjẹ. Èékánná wa, tẹ́báwò èékánná lómi ẹlòmíì ṣọ́nbọ́lọ́ báyìí ni. Our nails, fingernails have to be trimmed, well trimmed, whatever, because there is no way you wash it. They taught us how to wash hands, that we should put soap in our hands and use this fingertip to rub it like this. But for fingernails that are longer, will the person be able to do that? The person will not be able to do that. So all those things, all those habits are the root causes of soil transmitted illness. Or our mothers that cook meat for us and the meats are not properly cooked. Or those that cook vegetables and the vegetables are not properly washed, so that the microbes that are in the what is it called, the vegetable, wash away with water. They will not do that. So those are the areas where children and adults can contact soil transmitted illnesses. So these two diseases, how do we treat those that have it, and how do we prevent our children from not having it? We pass through the school avenue. We distribute the medicines in schools, and we target the school age children, age 5 to 14. Àwọn ọmọ tá máa ń fún ní oògùn yẹn. Brother mi ti ṣàlàyé fún àwọn ti sọ endemicity Schistosomiasis nínú 18 local government láti ní out of 20 local government in Ogun State. Ẹ̀rí pàgbìyànjú gan ẹ pàtẹ́wọ́ fún wa. 18 Odògbó ló nìkan àti Àdó Odò Ọ̀tà pé kò sí sí schistosomiasis bọ́ bó ṣe sọ wípé Odògbó ló àti Àdó Odò Ọ̀tà yẹn náà wọ́n ṣe report cases. Nítorí ọdún yẹn náà when the mapping was done it was only these 12 years tí wọ́n map pé wọ́n ní. But as I speak, in fact, the distribution we are planning to do, we don't have these 2 local governments in our plan, but we have them at the back of our mind that medicines that are remaining, we use it for them to treat the cases that we see there. Because in fact, we got a report from one of our lab scientists. Àwọn ọmọ yẹn àwọn ọmọ nìkan kọ́ àtàgbàlagbà tọmọdé wọ́n tọ̀ in that particular community ní ìrántí orúkọ community yẹn báyìí. Ẹni yẹn owó lè jàgbọ́ thank you. The person yes they share boundary. So the person was like aláàánú ni ó ní kí owó ọmọ àbọ̀ wá ṣe test fún wọn gbogbo pátápátá lè jẹ ẹ̀jẹ̀ ní positive ni for schisto. So we have it in mind to do an outreach for those communities. So that is that for schistosomiasis and soil transmitted illness. We have a lot of activities that we do in the state. We mobilize schools. We have health stakeholders meeting this week. We have done training for master trainers. And by next week, tomorrow we'll be having town hall meeting in our local government. The identified stakeholders. We have representatives from the Christian side, Khan, Lima, League of Imam Hanafa, the Bales, the Hobbers, the Akomorons, the Sergios, and so on and so forth. All those stakeholders that we have identified. So, because it's not something that health alone can do. So we do school-based development in collaboration with Ministry of Education and SUBE. Àwọn ọlọ́ni àwọn ọmọ yẹn títí wá ní wípé káwọn ọmọ yẹn kí wọ́n wà ní àlàáfíà kí wọ́n lè rí ẹ̀kọ́ wọn kọ́ kẹ́kọ̀ọ́ yẹn kí wọ́n lè yege nínú ẹ̀kọ́ wọn. Méjì tó kù sí community ni méjì tó kù wọn kó psychiatrist náà run lymphatic filariasis ìwúsẹ̀ àwọn yẹn náà wọ́n ní kòkòrò tó ń gbé wọn ẹ̀mí kúrò ló ń fa iná run. Mosquito yànmùyánmú àwọn tábà tí gbọ́tẹ́ ló máa yà wá lẹ́nu pé ẹ̀fọn ló ń gbé ìpá àti ìwúsẹ̀ kí ní ìpàdé àdúgbà yìí. Ọkùnrin ọrùn yìí ara máa yí bí ìgbà téèyàn ní kúrú náà àbí kára yí bí talágbà ẹwẹsẹ nìyí multicolor eléyìí pupa eléyìí dúdú. At the end of the day, if these symptoms are not treated, if this person àwọn tó ní kí ni tí wọ́n bá tètè tọ́jú ẹ̀ kó lo medicine, it leads to blindness. Total blindness, and that is actually river blindness lórúkọ míì láti ó pe ọkọ psychiatrist. Ìpàdé yìí ẹ wò ó ṣe tí wọ́n rọ́pò arákùnrin yìí ìpàdé léyìí ẹ̀fọn ló fà ó ti wà lára àwọn ẹni yìí tá a bá ṣe tábì fún ọ̀tá ìbéèrè pé kí ni ìṣe yìí tó bí ọdún mélòó ẹlòmíì tó jọmọ 40 years tání bí àbí 21 years àbí 24 years ló ti ń ṣe òun díẹ̀ ó máa wó di àsìkò yìí. Àwọn tó wà lọ́wọ́ tàbí ṣe sọ́jú fún wọn kọ́nà máa bá wa gbé wọn gà kó lè máa bá wa náà gà. So which other thing elephantiasis lele ṣẹ̀ṣẹ̀ sí àwọn tó bá nípa àwọn ọkùnrin má ṣe wà fortunate o because they can do surgery but this elephantiasis ìwúsẹ̀ yìí bó ṣe máa wà nìyẹn this is just for management ẹ̀ẹ́dẹ́sẹ̀ bá ti dé level yìí. But then tó bá jẹ́ pé stages ni we have stage 1, stage 2, stage 3 and so on. Stage 1 yẹn tó pèsè yẹn ọ̀rọ̀ awú díẹ̀ ni wọ́n bá tó tètè kàn sí wa tó lo methizane àti albendazole kí ni ìmàmà reduce ìmàmà wálẹ̀. And we also teach the person the exercises that he or she must be doing to ensure that this limb doesn't worsen up to this level. Àwọn àrùn ní ìtàbá ti sára àti mọ̀kọ́ tó ń jẹ́ àrùn ẹwà àrùn nínú ọmọ Indomie kọ̀ lélẹ̀ ìyá àrùn ni o. Ẹ wo okùn ọmọ ẹ wo okùn bí olóyún 9. Ọdún kan wà nígbàtà ìṣèbẹ̀rẹ̀ iṣẹ́ yìí ta lọ pín àbẹ́dàzò. Àṣepọ̀ wọ́n ti sọ pé ìyáálé ọmọ yìí ló ṣe mo ti sọ lórí rédíò rè. Wọ́n ní ìyáálé ọmọ yẹn not this ọmọ sorry. Bọ́mọ yẹn náà ipò ẹ̀ ṣe déédéé bí ọmọ yìí náà ni. wọ́n ti sọ pé ìyálé sí ìyálé ni àbíyáwó orogún ṣáà ni wọ́n ló fún ní nǹkan jẹ tí kò yẹn fi wú nígbà tá a pé oògùn àrùn tán bá bọ́ ọmọ yẹn pẹ̀lú ẹ tó jẹ́ champion tó wọnú community kiri pé kọ́ wá lóògùn ikú ọmọ yẹn wá wálẹ̀ bàbá yẹn wá karùn-ún ó lóun máa kà á nínú kóòtù ọmọ yẹn yá gbẹ̀yìn sí ó lóun máa karùn-ún yẹn ó ka 99 ó ka 99 kó tó dáwọ́ dúró eléyìí ó kì í ṣe pé bí àwọn sọ fún mi I happen to be an eyewitness ní ọdún náà lọ́hùn so ní ṣókí sọmárì nǹkan tí brọ́dà mi sọ tí mo ní kí á fúnra wa nìyẹn ó wá kù sí wípé ẹ̀yin agbóhùnsáfẹ́fẹ́ wa a máa gba feedback yín lẹ́yìn ìgbà tó bá ti bèrè questions and answers àti wá wọ ọ̀nà wo láti lè gbà bá ṣe lè collaborate ọ̀nà tá a mọ̀ tá a lè ṣe collaboration pẹ̀lú wa òun náà ni wípé ká pè yín ká ṣàlàyé àwọn àrùn yìí gba àwọn tó ń ṣe àwọn èèyàn wa nìyẹn tí wọn kọ bí ara sí o. We had this similar program, something like this. In fact, all the work in London don't do. This year going yes, January 30th. Before January 30th. 28 years. So we had a similar program where we called our media personnel. Our moment from Swiss on one day. That day me Yemi Abi Ṣẹ̀gbẹ́ mi gbàgbé OGBC right àwọn náà wà ń bẹ̀ but that platform náà wà ń bẹ̀ okay that náà wà ń bẹ̀ ẹ̀yin ò sí gbàgbé okay. Yes. So how we can work together to ensure that our state is free from these diseases. It is a sad news to tell us that Ogun State yìí láti ní 3 highly endemic local governments for schistosomiasis in the whole country. We have Bayelsa ní highly endemic. We have Ọ̀yọ́ ní highly endemic. Lagos no get highly endemic. Oya Akwa Ibom, Uyo, Bauchi gbogbo àwọn 36 states 35 yòókù Ogun yìí nìkan. Àwa la abọ̀ 3 highly endemic local government. Ó bá sọ pé 774 local governments. 3 minus 3 na Ogun State data.
Dábàá ní ṣe ẹ máa busy. Dábàá ní ṣe ẹ máa busy. Ẹ máa busy. Níwọ̀n lè sáré ó máa lọ gradually ní ẹni ṣe.
Wọ́n mi wà bóyá ẹ̀yin lè máa kọ́kọ́ sọ̀rọ̀. Wọ́n ní.
Yes now.
Dr. Chineye ṣé ìgbẹ́ fún mi sọ? Wọ́n ní tí àgbà ní ṣàmà busy. A lè busy níbò mi náà. A lè busy níbò mi. Wọ́n ní tí Ogun State wà ní.
Ẹ tí lè busy.
Àti lè busy.
Ẹ̀kọ́ máa ṣe kéṣà.
I actually don't like that kind of question because that's why some people are jeopardizing our
interest. Yes.
Okay. They believe that after eradication,
kí la fẹ́ ṣe pé kò ní ṣiṣẹ́ mọ́.
Ó máa wà.
There will be continuous
surveillance.
Àwọn fẹ́ ṣiṣẹ́ kú. Kò jẹ́ kí wọ́n lè máa ṣe gbogbo yìí.
Àwọn ọmọ yẹn
ariwo yìí sí ní
má jẹ́ kó sí ní
ẹ wá gbogbo ọ̀rọ̀ ṣiṣẹ́ ẹ̀ nìkan la fẹ́ ṣe
náà pé kí ni wọ́n náà bọ́ ṣe ṣe.
so please let's eradicate it and get something else to do.
Excuse me. When you want to eradicate, now when you presented, let me quickly appreciate the 2 speakers. Then you are collaborating with Ministry of Health, SUBEB, and Education. What about provision for protected water, drinkable water, sanitation, ODF, OSHILO, poor hygiene, OSHIWA, waste management, OSHIWA, ibẹ̀ náà máa ti kọ́kọ́ lọ ṣiṣẹ́ kẹ́tọ́ wá sọ pé treatment ó máa wà sustainable ó dẹ̀ máa eliminate. Now nínú slide yẹn I looked at it tí Mr. Adémúyìwá tó display mo rí wípé wash náà kò tí ì wà ń bẹ̀ mo dẹ̀ mọ̀ pé a máa ń jọ ṣiṣẹ́ papọ̀ ni when I was there. So tí ẹ bá tún jẹ́ kí ó pẹ̀lú àwọn ilé I think a sì ní ọ̀nà tó jìn.
because wash gangan ni originator àti wípé mi sọ pé kẹ́ ṣe ẹ má ṣe n tí mo sọ ni pé when you are collaborating that agency must be part of the NTDs, and I saw the slide, you can go back to it, it's excluded. You just mentioned it under the strategy. Under the strategy, level 1, you see, collaboration, you know, you have different strategies. Collaboration, mẹ́ta péré ló wà ńbẹ̀. You know, initially when we started the program in the state, we are pioneers, we started it. But SUBEB, health and education ló wà ńbẹ̀. Just go and check it. Add wash on WhatsApp for state. Sharing lórí wash tí kò bá ti ní protected water sources, tí kò ní improved sanitation, tí kò dẹ̀ ní proper hygiene. Actions is it. So they need to go and make provision for all those things. Kì í ṣe pé mo deliberately sọ wípé ní busy. Other states and underneath queries. Okay, this is strategy. Go to another slide. It may be another. But when you talk about collaboration, when you talk about implementation, this is implementation. That is why it is wash. Yes. But when you are talking about collaboration, that is the major activity. But I have to tell you because I'm here. Then, because of the media people to 1B, we are all working together for the. I have to say it. I'm for it. About the risk communication, everything about it is going towards risk communication. Thank you that during your presentation you mentioned the misconceptions, the rumors, the boya alarm pe ayé ló ṣe wọ́n bí Mrs. Eniola ṣe sọ. No, ẹ jẹ́ ká tún wo ọ̀nà mi. I'm talking about the media engagement now. Tó bá yẹ pé ẹ máa shift nínú promotion yẹn lọ́dọ̀ yín, ẹ bá wa gbé wọ pé àwọn kí ni Yorùbá misconception.
Àwọn àhesọ ọ̀rọ̀.
Àhesọ ọ̀rọ̀, thank you ma. So òun ni under risk communication, that's why I itemized it. Kẹ́ bá wa gbé wọ bẹ̀. Àhesọ ọ̀rọ̀ nípa àwọn àìsàn tí a àti ẹ̀ fojú sí tí a fọkàn sí bó lè ṣe wá tó dẹ̀ ń ṣe àkóbá fún àwọn ara wa tó dẹ̀ pé lọ́jọ́ wájú ó lè sọ wá di aláàbọ̀ ara. Tó bá jẹ́ bẹ́ẹ̀ yẹn ẹ bá wa gbé wọnú ibẹ̀ yẹn so ó lè wá padà wá síbi treatment. Mo mọ̀ pé treatment is perfect, you have like 100% coverage. Ẹni ìyẹn dẹ̀ ń ṣiṣẹ́ gbogbo èèyàn mọ̀ pa wọ́n ní wọ́n rí oògùn wọn gbà. Ní òkè mọ̀sán ọ́fíìsì tiwa náà máa kọ́kọ́ àmà ní ẹ̀ṣá olùbá mi bá wọn yàn. That was there I have it. Mo gbà lọ́wọ́ Dr. Chile. Mo fẹ́ mu lọ sílé. Mo fi sórí tébù bẹ́ẹ̀ nìkan ṣe wọlé. Ó ní àwọn lòun wá bọ̀. So bó ṣe ṣe yẹn. So risk communication then affected LGAs ẹ̀jọ̀ you can share it with them. Ìdí tí mo ṣe sọ bẹ́ẹ̀ ni wípé nínú list itinerary fún radio programs wa we have like for Ogun State àwọn náà máa mọ̀ torí a ní list wọn we have over 21 so bóyá ká wá wo àwọn senatorial districts ìyẹn la fi pín tó fi jẹ́ 21 so àwọn kan tó jẹ́ Ìjẹ̀bú Òde ni wọ́n ti máa ń gbọ́ jù wọ́n gbọ́ OGBC díẹ̀díẹ̀ bẹ̀ẹ̀ àwọn kan wà lọ́dọ̀ wọn tó jẹ́ nǹkan tó ń gbọ́ jù nìyẹn so ẹ jẹ́ ká lo radio station ibẹ̀ yẹn irú Ìjẹ̀bú zone a ní Alárẹ̀ a ní Super a ní Igu then irú Yewa a ní Saheed then méjì wà bẹ́ẹ̀ tó dà then Ìlaro náà àwọn poli Ìlaro wọ́n ń ṣe mo mọ̀ pé máa ń ṣiṣẹ́ pẹ̀lú FUNAB so FUNAB náà ní rédíò tí wọ́n so wọ́n dẹ̀ máa ń gbọ́ lálábàtà àti ní ọ̀bẹ̀tẹ̀ ọ̀pẹ jìmọ̀ra wọn so bóyá àwọn yẹn náà wọ́n ní ìnáwó so gbogbo àwọn suburb radio stations yẹn tẹ bá tún carry wọn along mo mọ̀ pé ó máa lọ for a long way then àwọn tó wà ní àwọn segment tẹ mọ̀ pé lè share pẹ̀lú wa ẹ jọ̀ọ́ ẹ lè share pẹ̀lú wọn so that wọ́n á wá sọ kó jẹ́ Yorùbá jù
tàbí ní èdè tiwantiwa bíi dialect ọ̀gbìn kan bá wa ṣe síbẹ̀ kán lè gbọ́ dáadáa ìyẹn ni mẹ́sẹ̀jì tó ń kà fún ẹ ṣe.
Ẹ bọ̀ pàtẹ́wọ́ fún àkórí rẹ̀. Ẹ pàtẹ́wọ́. Ẹ tún pàtẹ́wọ́. Pàtẹ́wọ́ lórí ilẹ̀. Ìdí ni ìdájọ́ sọ wípé health education unit has to be represented here. When I called Dr. Motosha and she said, I was around though, I was actually following up with her. I expected Mrs. Fanny to have called you. Àwọn ògbọ́n pa activity yẹn, àwọn ọmọ kọ́kọ́ mú ní ẹ ti wá gbọ́ báyìí náà nìyẹn, mi ti pè é pẹ́sipẹ́sí láì ní bí sí o. Ọlọ́dà àwọn ọmọ arọ́ màmá wa. Ẹ bá àpàtọ́ fún màmá lẹ́ẹ̀kọ́ sí. Ẹ ṣe àdókòwò so Mrs. Fanny, please confirm the list of the radio stations across the Ogun State that you have with you. Cross-check it with what she has. Kálẹ̀ mọ̀ bóyá we are on the same page. So, Mama ti bẹ̀rẹ̀, ká jẹ́ kó lọ báyìí, Sweet FM. Àwọn màmá yín ti dé.
Ṣé Yorùbá ní ká sọ pé?
Yorùbá dá o.
Mo kí gbogbo ìjókòó ìpàpàtà pé a kò gbìyànjú. Agogo ìdẹ̀lẹ̀ tí mo ìpolongo. A fi nǹkan tó pọ̀ lẹ́ka tó wá. Tẹ́ ẹ bá wá níṣẹ́, tẹ́ ẹ bá wá ń gbé ogun orí ó kù díẹ̀ káàtó. Number one. Number two ni pé.
Sorry, in English.
Okay.
You can give your consent to him. Record your voice so that they can send it to the country directly.
Okay, Miss Imano, what I'm trying to say is this. We that always take a time to come and sit with you to have whatever you want to tell us, to tell the community. We at times leave so many things for you to come and stay here. You know, having let's say an advert or information campaign. You're not taking it outside we that represent any media houses very bad. Number one, it not matter with we're disseminating the information. Number two is, as a media practitioners, we know the time to use this type of what is it called, adverts or information or advocacy. Unlike somebody who just sits on his own office, they just collect from you. They don't know the target. They don't know who you people are looking at. They don't know what you want, the result you want. They just want to take the advert from you. Let them help you place it. So please, I want to beg these sittings or evidence action in particular. Let's have a correction. I want to say, sincerely, I'm happy. If I didn't have evidence action, I wouldn't have come to come with me. That's why I call Mrs. Faleda, evidence action. I asked her, she said, I won't content. So I know she knew what I'm saying. So please, it's not about the money, but the way the message or information will be disseminated matters most. Now, let me go back to Mama. Mama, God bless you.
Yes, ma'am. Thank you.
I want to tell you as a media person, I don't know we've had up to 21 media houses in this.
Yeah.
Àwọn olóyè tó bá ọba mẹ́wàá ṣe yẹ kó sọ fún ọba mẹ́wàá pé bá a ṣe ń ṣe nílẹ̀ Yorùbá. God bless you. Amen.
To understand that, ẹni bá bá ọba mẹ́wàá ṣe tó ń sọ fún ọba mẹ́wàá pé bá a ṣe ń ṣe nígbà eré wọn lè yọ kúrò lórí oyè.
Network kan.
So one of the other things as much as possible is you know, processes and systems will always undergo change.
Yes.
And once some changes are above what you can make decisions on, at some point you just have the last round. It almost caused a rift between myself and Mrs. Kafi. Mindset. Your mindset was it was going to be the same way we were doing it before. And I discussed with her that, okay, let's go ahead and I tendered the issue. I can show you the query I got for doing that, because the first query to me was, did you not understand the policy around how these things worked?
Ẹ̀yin lẹ rúgi dáadáa lẹ́nu. Fanẹyẹ. À ń bá yín wí. Ẹ̀yin náà ni wọ́n ń kà.
Mo fẹ́ direct ọ̀rọ̀ mi sí Alaja because I can remember the last time we gathered here. That was I think January. Yes. And we concluded on some things. Even personally, I think I moved the motion that okay, on this issue of all the whatever that I've been telling us since, I think information is very key. Getting the information to the right channel. And Rama said, you have target audience.
Yeah.
If you want to go on here, you have target audience. And we that are here, personally, I can tell you categorically that time tí ó fìtì fún iṣẹ́ eléyìí tó kọjá announcement. In fact, I'm even saying that
information.
Bringing you
Schedule.
And you go live on radio.
Schedule of segments.
And say something about all what we have been saying this morning. Even though if it is 30-45 minutes, can we have more response and what I towards it? So what? Kuma in Shelesha. In fact, we go back on what for the first time. Yes. Pẹ̀lú bí òjò ṣe ń lọ nísìn tí ọ̀gbàrá ń lọ káàkiri, all those things ṣe is it possible for us to walk on the street without matching all those things? So there's something that we need to caution ourselves from and they take note of without any information. So we need to come on here and sensitize the public, let them know the importance of all these things and the nemesis. So that if you observe this, it means that something is coming. And nobody was sharing because we used to say that prevention is better than cure. So who better can prevent it than come and lose. So and then I want to add to what Rama said that listen, I've been here now because when Mrs. Fanny, when she called me to that night night, and I believe Rama could get me with me. She night now. Mo tún ṣe program láàárọ̀. Mo ṣe parí program ẹ pé kí n kàn rest for like bí oníkọ́ ẹ̀ wọlé. Mo kàn rántí pé yé ètò ni o. So I have to run down to and come back. So and then now about the time, okay, the Ministry of Health, they want to go out en masse and bombard the general public on information. So we want to look at radio stations and my guy will now say, well, if you told no just see, ṣé bíbẹ̀ ni wọ́n ti ń ṣe yẹn, ewu orí kankan wá ṣe gbà yẹn. So then what now the essence of me coming here?
Only schedule of segments.
Good afternoon. My name is Mrs. Shulibo and I work with the State Broadcasting Corporation. I would like to take it from two perspectives. I think in the early 2005, there was so much noise. You are making it for me. Like when you always come, I will tell you, help me to help you. You know, she knows OGUN very well. We have done so together. If I am bringing you to the marketing and my name is like this, if I'm bringing you on there, nobody will query me because you have paid. Yes. They've seen neglected tropical diseases and we are talking about it on radio. Nobody will query me, even if you are giving me money. You understand? So please help us to help you. Then two, please testimonial on the field. Yes. When you go there, and you have a car 90 something. And they can visit one carry. Kò sí voice to that event. Mo bá wọn every year. And to ti ṣeré. Tó bá sọ, tó bá gbọ́ fúnra wọn, they be like, wow. All these things that you're talking about, you've told me over and over and over. I was just looking at what is that new thing you want to bring on the table? Okay, I can see you treated 124, 174. Beautiful. And that's good for it for me. We still have more. So if I'm going on radio now, what I will tell people is, so far, between 2023 2024, we've been able to play 5 demo 124, I could sell 174. But my people will still have thousands in our. So those are different angles to it. God will help us.
So I want to add to that.
Pàtẹ́wọ́ fèmí ṣá o. Pàtẹ́wọ́ lọ. Pàtẹ́wọ́ fẹ́ yín lẹ́kọ̀ọ́. Ẹ̀wọ̀n pàtẹ́wọ́ yà pé pàtẹ́wọ́ mi sábọ̀ gbogbo. Jẹ́bísí. Àsọ̀lájú púpọ̀. Bàbá yín dà. Sí ìyọ̀fìlà náà. Bàbá àgbà, bàbá Yorùbá. Ó wà òkè.
On this, anytime you want to, maybe you want to run an advance, or you want to do anything.
Insert. Let there be insert.
You just want to disseminate an information from your ends, you understand, to all the medias. Consult the people that are present in this something. If you come, this is hygiene. More àwọn ibi tí mo ṣe pé káàpọ̀ ṣe ń sọ̀rọ̀ lẹ́nu mo tí mo pé should I bring out.
Máyì tí bẹ́ẹ̀ máyì bẹ́ẹ̀ ìfẹ́ ẹlẹ́gbàá ìjẹ́kẹ́gbà níyì. Ṣẹ̀jú tẹ máa gbé wọn bọ̀.
Exactly. Ṣé bí àwọn presenters especially presenters a mú àwọn ibi tí ẹ ti lè tó pé ẹ̀dọ̀ tó pé àwọn ibi tí even before you say a word for 5 minutes. You will receive calls. You understand? So, get in touch with us. Help us to help you. Don't you so? Share get mine. So that by the time, even though if you bring any advert or whatever, you will run it, and you now want to come. In fact, I can invite you there. You need to come and talk more on that. So please help us to help you. Help us to help you.
That's the slogan.
Thank you very much. Let me quickly respond to and they will now, what is it called, hear it. We will not know the person that hear it. In fact, we not even used to waste our time to listen to it at a kingdom. They started this about 2 years ago. So I don't know. Majority of these things that I'm sorry to say. Majority of us, we are self-centered. That's just it. In of Cafe, you know, here, the question is so plain. Mrs. Kafin is so faithful. If you do anything for 200 naira, we say it is 200 naira. Because they ṣe ní 200, tó bá sọ pé 300 la ṣe. Lọ́dọ̀ tí tiwa nínú ẹ̀sìn táwa ń ṣe àrámù ní owó bẹ̀rẹ̀. Ọ̀tọ̀ ni tó bá fẹ́ sọ pé ẹni láti ń ṣe láti ń jẹun, ọ̀tọ̀ ló máa fi transportation cost sí. A lè fẹ́ lọ sí field àmà lọ ṣiṣẹ́ ìyá máa gba transportation. So why should I add more to the money of a particular activity? Me, we are communicating.
You are communicating.
The way you sing 300, for example, 300 pieces of this. Kiwara 100. Kiwara dàrú mọ́ àwọn èèyàn lójú pé 100 ìmúra. Kiwara 200 sápò. Àràmù ni o. Nínú ẹ̀sìn tiwa, àràmù is things that are not lawful.
Yes. Because when we are there, you still be paid.
Tó lè jẹ́ pẹ́ṣẹ̀ ni. Nítorí pé eléyìí, bí yóò bá àkáǹtì fún láyé máa lọ àkáǹtì oníyàwó àlùkìyàmọ̀. So we don't do that. But on the other side, kí táwọn èèyàn ti ń jẹun nìyẹn. And nǹkan tẹ̀mírí tó wà behind gbogbo nǹkan tó ń ṣẹlẹ̀ yìí ni. So let's see. Maybe we will not have results. Tábà ti ṣe jíǹgù.
Okay, thank you. So sorry.
Hello, sir.
Off record.
Ẹ jẹ́ kó kẹ́rìtẹ̀ pé gbogbo wọn yẹn lẹ́jọ́ ń ṣiṣẹ́. Ẹ má jẹ́ kó jẹ́ education ṣùgbẹ́ or health nìkan lẹ́jọ́ ń collaborate. Ọlọ́run lè ṣe ń jọ kan kó máa ṣe mẹ́mú yín kí ojú wọn là pé okay, Minister of Information and Strategy on NTD, these are the inputs that fẹ́ fún yín. I think it's better your presentation will come up with positive ideas and then you see the light of the day. It's a suggestion, no?
Ẹ má bínú, máìkì ẹ ti wà lọ́wọ́ yóò ti ṣe díẹ̀. Àwọn sọ̀rọ̀, àwọn náà ti sọ̀rọ̀, ẹ má bínú.
Actually, I appreciate this program and your efforts. And honestly, what you are, sorry, representing from GFA. Honestly, I'm hearing some things today, and it's so surprising. In fact, I would say that since I've been giving birth to, this was a year that I would always say that our vaccines have been born. This year, I've never felt sick in my life for a long time that this year I experienced some things. In fact, I never knew that there's a drug called antibiotics. So this year I started knowing that this is one antibiotics because I've never been to the hospital before. Maybe right from my childhood, that was the last time I visited the hospital. But this year, I know what it means when we are talking about health. And I've been to hospital, I see so many people, I'm like, I'll be crying for people. So this is what I'm going through. And I know that God really wanted me to be here also to learn more. Because honestly, my drug is only malaria drug and paracetamol. I don't have anything. After that, for this year, glory be to God. Now, when you were talking about
àti ṣe social media. mo lè wá ń gbọ́ pranciquante ẹ wá ń gbọ́ ivermectin.
Before I come to this issue, I don't know how you people have been doing it. And I want to bring the media practitioners that are also here present. I believe they are in your group, whereby you disseminate information to them. And then I want to also talking about some radio stations, some media stations in the state, the numbers of stations that we have, which is very commendable. But at the same time, I also don't know, maybe anytime you are going for your, we call it outreach, right? Anytime you are going for your outreach in a particular zone, let me use Ijebu North as an example now. Now we all know that, okay, Ijebu North, you are going there must be a particular radio station that people in that zone are always listening to. So before you people go for your outreach, I want to believe your information is well disseminated. Oh, in 2 weeks' time, in a week time, we are coming to your community. Awareness. So that once they air it on radio, just like when churches are giving their outreach,
Power bank.
So you understand? So with the help of the community leaders, with the help of the religious leaders, even when like Redeem Camp now, Redeem Camp, everybody goes to Redeem Camp. Everybody goes to Redeem Camp. If they are stuck, you see, this is health, this is humanity.
Yes.
It's giving. So if there are opportunities where you can also come up, broadcast this when such massive programs are going on, so that people will be aware. A lot of people have died just because of little things.
Yes.
Honestly, a man like me at my age, it was this year that I knew that there's what maybe my friends would have been treating us with some medication when we were kids, but am I for 10 good years? Until this year, that's when I got through that there's something that you take antibiotics for medication. Maybe my wife does it. So are you getting my point? So a lot of things that people need to know. It's not about those who went to school and graduated.
Yes.
I'm learner, I can speak, I can no. There are some things
information.
Ignorant.
Yes. Information is power.
Information is power. So let your outreach be 2 weeks information to people so that they can just come, you educate them before you start. There are some parents, like I tell you, I explained something sometimes ago, whereby there were this immunization that they were trying to do to some people. I think I saw someone say, I'm not from you, because she felt
she's not secure.
She's not secure. That thing may harm that child, but because I'm sure if she's educated, if she's aware, if she's enlightened, she will allow them to give that child. In my own children's school, they'll just my children come back home, they've come to give us something. Church at for you.
Yóò bá yín lára mu. Sọ pé kí ló wà fún.
No, because I know that it's called immunization.
Yeah, sure.
Whatever you are immunizing, just immunize them, and that is it. Since it's approved.
It's safe.
Now, in the area of the river stuff, I mentioned that even before my son went for baptism, I as a person, I just grew up and I just saw that down. I have been to river when I was a young boy, swim in rivers, In fact, I will be begging, the water will enter our head. But because we are ignorant, then we didn't know that we are inhaling, taking in diseases and all those stuff. We must have been falling sick as children, our parents will be treating us, or we don't know. But at the point when I said, going into swimming pool, for me, is a no. Except that pool is my private pool. Pool should be private, not public. We tell us having pools, I don't know why they are having pools, but it's somebody going into the pool. That person must have 1 or 2 diseases on his or her body before going. And that person coming is painting all those stuff, even on that way, let them do it for 2, 3, 4 weeks. You go into the pool, and so I actually don't have flair for going into the pool. So when you now say something about the river baptism, it just occurred to me that this boy did baptism. In fact, when he came back, I was asking, the water enter your blood, water. But if I know, I would have said, don't worry about baptism. They cannot put you inside the bath. Forget about it. So, few weeks after, maybe or two, within that short time of period that he went for the baptism, not up to a week, the boy started feeling feverish. He felt feverish to the extent that he was vomiting, stooling. They tested for malaria, they treated typhoid. So, but glory be to God, he's fine. But the Bible was like, if you have that drug, after swimming in the river, can I go and still give it just to use? So, things like this. Now, if such a child is taken to the hospital now, they are treating something that is not. So, not knowing that just baptism can cause wahala. So these are the things we need to still sanitize our people more on. So not just, some of our media participants, we are so passionate that we have a program that this is what we want to talk about today. But because of the humanitarian part of our life, we still want to say something just to enlighten people. Do you understand? So please also look for another strategy of how you can do an outreach. Like, we are coming to a community, you put out speakers at so hours. They go TV. If you see all this MTN, Globe, where they'll be doing the advert, they'll put dancers, before you go, there are crowds there. Keep saying it until it becomes eradicated. HIV, like you said, when they talked about HIV those years, yes, today, people are still abstaining from unprotected sex. People are still not getting their own papers or whatever. They still keep coming up. So that means the information will never stop. It must be continuous until it gets to a level that is it is now 2%. Zero. Another thing, before I drop the mic, this is it leprosy? Don't pay the super.
No. Eteni leprosy.
What's that one? That one that is swollen under the. What do you call it? Hydrosis.
Or a large scrotum.
A large scrotum. I said something about mosquito. Is it that the mosquito bite is mosquito biting the body?
I want to see so Benny now. I like you.
When it comes to mosquito,
kò sẹ́ni tí ò kí ń jẹ́ o.
In fact, if my children have any little mosquito bite, you think it's lying on that?
Benny.
I said, if I see mosquito and lion, I will fear mosquito than the lion.
Yes, because to baby no mole by.
Because I can never sleep where there is mosquito.
Yes, I am a.
Where there is mosquito, never. If I go anywhere to visit anybody, please share the net.
Yes, we have. Sure.
If you don't have net, you must look for that net. Me and my wife will stay inside net.
Yeah, I promote now.
So, that is wealth.
Yes.
It's not about money. When you are healthy, you think straight.
Yes, you
have everything.
Yes.
A lot of people have this money and they have health issues.
Yes.
And the money will not
get useless.
So please, let your outreach be let's come. Like we suggest that people will sit down, you create it for them, they will listen and they will keep educating one and another.
Then the process we share the fire.
Thank you very much. Ìdáhùn béèrè wò tí wọ́n sọ wípé ṣé yọ̀mùyọ̀mù yẹn ṣó jẹ́ ní ẹni scrotum? Àní ṣàárẹ̀ pẹ̀lú
àmì àárẹ̀ ò sì ní ṣe wá.
Yọ̀mùyọ̀mù tó ń gbé ẹlẹ̀ ọlọ́ọ̀ni tí ó jẹ wá. Àdúrà ni o. Torí ó ní oríṣiríṣi yọ̀mùyọ̀mù bí i different species of mosquitoes. but there is no way we can identify them except the scientists. Àwọn kan wá tó jẹ́ pé wọ́n fi ń ṣiṣẹ́ ni àwọn ọlọ́mọ àmọ̀ pé títí malaria lélẹ́yìí o títí lymphatic filariasis òun lélẹ̀ kọ́nà ó ṣàánú fa. So anywhere ló ti lè jẹyàn kò pọn dandan kó jẹ́ pé bóyá in fact tí bá tún wá sọ obìnrin fún yín kọ́ tó bá jẹ́ pé inú ọyàn ni microfilarial worms ẹ ló gbà lọ ọyàn yẹn máa ṣùn wálẹ̀ ni kò ṣe ṣùn wálẹ̀ kò bóyá ó ti dàgbà ó ti fọmọ lọ́yàn o ẹ wò ikán rèé ọtún rèé bó ṣe máa rí ni tòsí àwárí báyìí.
bí ọmú rọrọ.
ọ̀rọ̀ gbọlù. so máa ń ṣẹlẹ̀ bẹ́ẹ̀ so kini yẹn máa ń rìn just like blood flows in our body system bẹ́ẹ̀ yẹn ṣe ń ṣàn lára tómi yẹn ń ṣàn lára tó bá dé stage kan tó débi tó jẹ́ wípé blockage wà.
báyẹn gbà sí.
So ibẹ̀ gbogbo àwọn kini yẹn máa sára sí máa sára adẹ́kọ̀ọ́ máa wú ni so yẹn ni àwọn onípa ṣìdá tẹ́lẹ̀sẹ̀ ńkọ́ òtó nípa àwọn operate wọn á kọ sọ àwọn do's and don'ts fún ni tí mi ò tún ní fẹ́ padà wá mọ́ bọ́tí tẹ́lẹ̀sẹ̀ ti sí reversible kò ṣe operate àtẹ́ni máa máa gé ẹsẹ̀ o ó lè nìkan amputate ẹsẹ̀ kó wá lo artificial limb ìyẹn nìkan ni.
wọ́n lè ní tó lọ́n jàjẹ́ ní ọ̀sẹ̀ ní ọ̀dẹ̀ ní
so Mr. Emmanuel thank you very much for your contribution. In fact,
these drugs that you are giving.
Yes.
Are they preventive or to treat?
They are both. When I say for the preventive chemotherapy,
I just want to.
They are both for prevention and for treatment.
So by collecting it, you are preventing it.
You are preventing, yes. But by saying so, we won't wait. See, gathering back what you buy, shall I achieve what I achieve?
In fact,
àbí àrò pé àṣì gan ṣá.
we did Ọlọ́run.
Ó lè máa wá mi ní ìfọ̀lù ẹ̀fọ́lù Ọlọ́run bá torí kan ṣe kan ní.
ẹ̀rọ pé kìlà rẹ́dí tí yóò bá pọ̀ nígbà bí
in the aspect of testimonial that you're talking about, so this year, my organization is something around photo, video and photo documentary, where we interview people we've been working with over the years. Beneficiary Mrs. Kafi was also interviewed as a lead person for NTD in the States. So we also interview beneficiaries like in Oyo State. We had a child, we had a scenario where a particular child was always coming as a class. And they already saw that the boy was not doing it. The NTD team got after the first round of the voting. So consistently the boy from last he moved to I think 10th position. From 10th became 7th. From 7th was always first till he graduated. There was also another case. This one I was even the one that led the team to the house. The boy is always passing out urine. And you know the unfortunate thing is the stream that houses the snail, that's when they cross every day to go to school. If you know, I don't want to mention the name of the elder boys. It's on your way to Oyo town. You're going to Oyo. So the boy was always passing out urine and he's always sick. The mother, they told the mother we how to do it? So the mother was because and he was always passing out urine, blood in urine. So after the first round of the we took Pascal noticed that he stopped. The second round noticed that he stopped. Now the boy is no longer passing out urine. And then passing out blood in urine. And now that particular community is actually endemic for Shizo, but they don't know. If you go there to go and do anything, they say it's introduction to maturity.
Yes.
For the male child in their community. So by the time you start passing out urine in blood, it shows that your
that is a sign of maturity communication.
Yes.
Sign of maturity.
Sign of maturity if you're passing out urine. That's what the community understands to be. Not until sensitization is done. So we're doing something around those photo documents where we take testimonials of both parents and SAC, even principals of schools were interviewed to tell their experience around the world. So by the time the compendium is out, we definitely share with you so that it can become a messaging for us through you.
And so we also our own in Ogun State. This is it is high time Mr. Odubi. Our success story is there. So
one of the elders went to the girl committed war after taking the medicine.
I want to young designing picture in there. So Baba Olomo 99 yẹn ti pẹ́ àti aláàmọ̀ 99 ayé àwọn Mr. Ogun àwọn Mr. Ogun ni mo bá jáde lọ́dún náà lọ káàdì má bá wọn jáde mọ́ kó ti jáde láyé báyìí. So we will work towards it. In fact, I'm very glad and I am happier for the feedback we are getting from our media practitioners. Ọlọ́run àtúbọ̀ máa bá wa pín lọ́wọ́ á lè máa kún àwa náà lọ́wọ́ pẹ̀lú òpèlú. We are rounding up torí àfẹ́gbà àkókò wájú nígbà tá a bá bẹ̀rẹ̀ ní 30 minutes 45 minutes. So let me call on. So share Mr. Emmanuel. Okay. So after evidence action, Mr. Dube, you will come out and appreciate our media personnel for us.
Yes, good afternoon. Thank you very much, media representative. So much appreciate you coming today. Now at least some of us have been here since we started. That was 2017. Evidence Action has always been supporting Ogun State in terms of treating worms. And of course, we just want to talk a little bit of ourselves as we are gathered, because that's one of the most important things. Yeah. For evidence action, we scale local health intervention to reach hundreds of millions of people in Africa. Of course, we are an international organization. Our approach is designed to create the biggest impact at the lowest cost. We leverage rigorous research to find effective intervention. We focus on three things. Everything is grounded on three key principles, which is evidence-based, cost-effectiveness, and at scale. When we say evidence-based, we go to the field. I'm a lossy field. I found one local. Àwọn success story wa náà ní pé àrí pé àwọn ọmọ yẹn yà àrí pé ó ń bá wọn lára wọn. Kì í ṣe pé àwọn fún wọn lóògùn nìkan. Àbábalẹ̀ tó dẹ̀ la fún wa encourage because we are going into another round of treatment. We ask school children to be given this medicine in the morning. Ọmọ tó bá ṣeré láti àárọ̀ títí di ọ̀sán, àwọn ìgbógun yẹn bá lára wọn. And we have designed an health center in each one to take care of this. Bóyá ọmọ yẹn react sí, wọ́n á gbọ́ ọmọ yẹn lọ síbẹ̀ for proper care. So when we say we are cost effective, we manage it in a way that, okay, owó tà ná ó yield the results. And that is why we are engaging media value stakeholders. In fact, our people are going on Friday to each local government and they will invite key stakeholders. And they can invite Baba Loja, Yaloja, Reverend, Chief Imam. These are the stakeholders that will also help us to spread this news in churches, in mosques, and the educational body and the rest. And part of it being what I will be from the media organ, the media body, to help us with this as we are treating it. Iṣẹ́ tá à ń ṣe yìí, iṣẹ́ kì í ṣe pé káwé pé owó tó wà mẹ́wàá pé ká ṣe fáwọn ọmọ tí wọ́n ń lọ òkè lọ́fẹ̀ẹ́. Because WHO, that is the support we are having as we countries that we are high over there. But as they are supporting us, let us look for a way to give out this medicine freely to these children. And at scale, it's very effective to scale up into other areas. Now, our strategy is evidence access to an ambitious goal in doubling our impact by 2014. Our unique strength, scaled reach. We have reached over 250 million people across 9 countries through 4 programs. Strong deep relationship with governments across 9 countries in Africa and Asia. Rigorous evidence monitoring and data analysis, delivery excellence, and non-compromised standard. Let's move to because of our time. Where we work, I told you, we are an international organization. We are in Cameroon, of course, we are in Nigeria, in Liberia, Zambia, Pakistan, India, Kenya, Uganda, and Malawi. And you can see the data. We've reached so many, 250 million, 70% this and that. In fact, in Ogun State, we have had 5 successive rounds. We now had a research and impact assessment to assess how already have that in your already have that in your also add that A decade of outside state. A decade of outside impact. All the figures. 450 million people reach globally, 10 million people reach with access to safe water, 1.8 billion, deworming treatment delivered, $23 billion in productivity gains from deworming, 15K children lives saved, 3 million child diarrhea cases averted. Evidence action in Nigeria overview. As you can see in Nigeria, we operate in Oyo State, Ogun State, Lagos State, Cross River and Rivers State. We registered in Nigeria since 2016. You can see that we registered in 2016, and I said that we started in the global Nigeria has the fourth largest number of children at risk of worm infections. We target over 6 million children, school-age children annually for schistosomiasis and soil transmitted worms and soil transmitted. And as we are even moving to this one now, we are treating both infections. The work is based on robust evidence that shows the deworming has immediate and long-term impact, reduces school absentees, increases income. What is of the states, Mrs. Kafila, they've talked about it. There's no way the person will concentrate in school. So it has improved the well-being of our people. Our technical assistance model, the first one, which is policy advocacy, prevalence surveying and mapping, program planning and management, public awareness and mobilization, training and distribution, and drug management coordination. Our deworming work in Nigeria, our deworming work program targets 6 million. We collaborate with the government to train more than 28,000 teachers, distributors, health workers to deliver deworming treatment. We collaborate with both health, education, and super ministries because although we are treating all children, because we are going to collect data. We can't come out with a model that we just meet the children outside and just give the deworming. So we went through the school. The school, we went through the teachers. It is the teachers that will train teachers, and teachers will go back. Or that deworming day they give out these tablets. So the data of the school children, don't you want school they will be able to know the actual age of the child. Then the teacher can also give this medicine and also look at each child till the late hour when they will leave. So we go through that. Also for the children that are not in the school, project where they are not enrolled in the school, we provide health facility. We provide a medicine health facility so that they can go to health facility around them. And of course, if they don't mind, they can also go to the school to take this medicine. We call them non-enrolled children. So we collaborate with the education sector targeted to treat more than 27,000 schools annually every year. We provide logistics for the movement and position of more than 9 million tablets of medicine and transport training and 3 levels of casket, training more than 2,500 government personnel from education and health. Now we have reached over 36 million SAR. Treated at less than $0.5 cost per child treatment. And you can see the status. Overview of SPD in Ogun State. Prevalence mapping shows that all 18 LGs require treatment for either STH or schistosomiasis or both. Just like Mrs. Kafila said before, 4 LGs require yearly treatment for STH. Anyway, successfully, we have to treat a space of 5 to 6 months, then we'll go back to the schools again to treat to the LG. All was carrying one level treatment of schistosomiasis in 18 endemic LGs. Tabali endemic, I want to get yes, that is where we can find this infection. From inception to date, a total of 10 to 11 deworming are taking place. In over 11 deworming runs are taking place. Till date, the first school-based deworming exercise in the state took place in February 2018. The Ogun State Ministry of Health released the NTD program in collaboration with other relevant ministries and departments in the state, which is education and super and other stakeholders. Now, program implementation cascade. This is how we go about it. First of all, is the micro planning meeting. Key personal representatives from education Super MOU and PhD from the state agency needs to provide details for implementation of school deworming program. When we say microplan is that especially from education and student and also from the health, they provide a list of schools in the states. They provide the head teachers, contact and phone numbers. The health also provides us with their representative from health facilities. They also give us information about town announcers that are also working with us. So that is what we call microplan. Now the second one is master training. The master training is when we train state officers. State officers are the ones that will go to each LGA to go and train either even the teachers and also the representative, the LGA and people. So the next one after that, after they train them, those people will now go to each cluster to train teachers. What we do is that in each LGA, like in an LGA now, we can have up to 10, 12 clusters. In one cluster, we can have 30 teachers. Each teacher representing a school. Now, these teachers will be trained. When these teachers are now trained, they now go back to their school. They will now go and train other teachers in that school, providing medicine for them. So that on that, like we are having it on 22, which is Wednesday, October. On that day, in the what they call this early morning assembly. So yes, immediately after that devotion, each teacher in the class will give out medicine to the students in their class. Now, for the deworming day, of course, which I mentioned is 22nd for this one, which is October, teachers deworm. Reverse card, the return of monitoring forms and financial accountability. You know, I told you that we don't want to give out medicine. In fact, our medicine is based like this. From the World Health Organization and from the Federal Ministry of Health, this our medicine we are giving 5 to 14 age. 5 to 14 children age. So these are the children we are targeting. So after giving out this medicine, their registers are provided whereby they will show in each class, after moment to absent, after moment to sick. Torí àkínfọ́ tó bá sick ní òògùn wa kó má lọ dà. Ọmọ tí ò bá wá school want to know if ìgbé kò wá sí school ká lè mọ̀ ìpè yes. In fact, that document will also give us the number of pupils in that school. That document will also give us the age bracket of students in that school. Correct. So now that is the reverse cascade. So now this is district. Now these are the 10 LGAs we are targeting. Okay. Ewe Goro, Jabu is Jabu North, Kenya, Nekwafu, Odeda, Odasai, Remo North, Yewa North, Yewa South. Or probably, of course, I think I've seen Mr. David where they are going to give you this information so that you can help us with this one. Yes. These are the treatment plan. She's even in some local government is only one treatment plan. While in some local government we have those two. So let us move on because of our time. Thank you very much.
Thank you very much, Mr. Gabriel. So we are rounding up. I know every one of us has written attendance and payment documents for our transportation. So Mr. B, please give us.
Sorry, please, before the vote of thanks. Please, for God's sake, I want to say this. Anytime we two are here, can you do give us this medication for people who are willing to take? You understand? Because nígbà mi àwa la wà ń di ọ̀rọ̀ àròrò jẹun. Àbíjọ́ ti bá wá fún Mrs. Kini lọ́rùn ní pé alẹ́ ẹgbọ́dọ̀ fẹ́ mi. Alọ́kọ́ mi sàn kankan jọ kan pé ṣé bí wọ́n sọ pé wà nídìí oògùn àrùn ó dẹ̀ gbóògùn àrùn wálé fún wa Ọlọ́run gbọ́. Ṣé bí remember? Dókítà láti lọ pàdé ara wa fún àtàbẹ̀rẹ̀ sí ní kọ̀wé kiri títì. Interest. They don't give us yo.
No, they are not saying they are not giving.
Àwọn bẹ̀rẹ̀ pé wọ́n yìí máa fún wa rí ẹ bẹ̀rẹ̀ sí ní fún aláàṣẹ yìí. Kí ni ṣe wọ́n gbà rí? Àti gbọ́n máa fún un. Ẹ ṣeun.
Ẹ̀kọ́ mi sílẹ̀.
Ẹ jẹ́ gbé kámẹ́rà sójú yín káyé lè mọ̀ pé promise pé fún wa.
We come to your radio stations, Mr. This is the pledge.
Wọ́n dé o.
This is the commitment. Àwọn bá a kí ni.
Àwọn aráàlú wa
náà wọ́n lọ lẹ́kọ̀ọ́ sọ̀rọ̀ wàrà mọ́tòlá wàbára pàtó.
Ara ẹ káàbọ̀ mọ́ ẹ káàbọ̀ sà.
Ẹ máa bọ̀ ẹ máa jókòó ẹ máa fi kalẹ̀ sí
sọ fẹ́ náà lélẹ̀.
Ẹ káàbọ̀, ẹ kú iṣẹ́, ẹ kú rìn.
So this is a pledge, and I'm pledging on behalf of the state coordinator that we will treat everyone, in fact, all the radio stations.
Please.
What you are going to do for us is that, please, on that our platform, on that our media platform, just tell us how many are you in your station. Tabati mo ye number yín, that will enable us to plan well. Àwọn ọmọ Yorùbá máa bọ́ wá sọ́dọ̀ yín.
Oníjọ́ mi tẹ bá fẹ́ wá, gbogbo wa lè má sí on duty ṣá o.
Kò sí wàhálà, there are ways to do that.
Tó bá wà ní duty, wọ́n á jàǹfààní ẹ̀, right?
Another thing we can do is that each of you here, you are our CDDs. We will use you as our community directed distributors. We will train you. Okay. We have this measuring tape that we normally use to administer the medicine. For Abedazo is 1-1 for everybody. But for medicine and for Pratis-Quatel, we have to administer it based on height. So, Guru Lenin,
the maximum height is
administered. It's not something that is difficult. Just place it on the wall, then let the individual that wants to benefit from the medicine lay on the wall. If it's height, so, what's the problem?
Thank you so much for that. Amen.
So I want to welcome our daddy. Bye.
Kíni ilẹ̀ Yorùbá ó ló ti di yunifásitì báyìí ó ti di yunifásitì. She's from another station.
So you introduce yourself so that you might not make mistake.
Good afternoon, everybody.
You're welcome, ma'am.
My name is Olara Mosegadebanjo. I'm a presenter of
AKA Ara.
AKA
Yara.
I'm a presenter of Ayewo Fame from Alare FM.
Phone number,
my name is
attendance sheet.
Back in the balance.
Yeah,
I'm representing Lion 93.9 FM.
Lion Day.
I would like to apologize
for coming
a little bit delay. So we are maybe going on to sell especially along Ijebu, the Sagam road. And there's a heavy traffic, very heavy. So, ẹ má bínú bá pẹ́ díẹ̀.
Ẹ káàbọ̀ sà.
Mo máa ń kí nípa wáyé àlẹ́nu. Mo kí ẹ̀yin ìyá wa àti bàbá wa tẹ́tí wa wájú. Nǹkan wáyé àlẹ́nu ni pé tí a máa ń ṣe nǹkan wa nígbà ní bí Ẹ̀gbá àti ṣe ní Ogun State. Mo lè máa rí báwọn tó ń ṣe nǹkan bí Ẹ̀gbá yẹn. Many of them are from another political zone like Yewa or Ìjẹ̀bú. Àwọn bàbá wa àtàwọn ìyá wa tí wọ́n dá Ogun State sílẹ̀. Wọ́n mọ̀ pé Ògùn orúkọ gbogbo wa ni náà tó orúkọ Ẹ̀gbá. Tí wọ́n bá sọ fún ilé, we have almost 6 standard radio ní Ìjẹ̀bú àbíkọ́ 6 standard radios. Ẹ mọ̀ tẹ́lẹ̀ ní.
À ń lò.
Ẹ lò.
Kí ló dé tẹ̀sán ẹjẹ́ ẹ̀sọ̀ tó.
Wá sọ ẹ̀rẹ́ mo sọ ìpínlẹ̀ yàrá ní tí sọ àwọn online radio. Lọ́jọ́ kan mo ń lọ mo pàdé ìyá wa àti bàbá kan wọ́n kàn lọ ní àwọn ògbó. And so sometimes I have to say any radio méjì mẹ́ta mẹ́rin márùn lẹ́gbàá àgbà àti ṣe nìyẹn. Mo ti rí program àti ṣeré tí wọ́n ti polówó ní Ìjẹ̀bú rárá. Lóòótọ́ wọ́n máa ń pín ìlú ní rédíò Ẹ̀gbá ó máa gbọ́ ní Ìjẹ̀bú. Torí bí iṣẹ́ rere ó máa ń pẹ́ kó tó yọ. Ìwà burúkú ó lè máa mú ọlọ́mà ti wáyé. Mo fẹ́ kí àwa ọmọ ẹ̀ka náwó wa dé àwọn pàtó especially ní Ìjẹ̀bú-Land 6 radios tó standard tó láwọn presenters tó láwọn programs táwọn èèyàn dẹ̀ gbọ́ tí wọ́n ń gbọ́ 100% tí ò bá jẹ́ wípé ìfẹ́ tó lè ṣiṣẹ́ but ọwọ́ kìíní yẹn pọ̀pìsì yẹn débẹ̀ yẹn tó bá jẹ́ pé a ní àwọn kankan tó ń bòdì gẹ́gẹ́ bí òfin àti authority kan ẹ sọ kí wọ́n díẹ̀ kí wọ́n jẹ́ káwọn èèyàn gbọ́ nípa àwọn ọ̀rẹ́ sí ọlọ́run jẹ́ kó bàjẹ́ wọ́n sì ní àìsàn ọ̀rọ̀ sí.
A ti sọ̀rọ̀ gan-an.
Okay, thank you very much, sir.
appreciate you. Now, before you came, in fact, we are about to round it up. But that is the reason why we are here. And the same government with the supporting partners, that is the reason why we are here. And the same government with the supporting partners now, there is implementation in the states in terms of distributing children for schizophrenia states, Yatosaja and Yaroni across the 10 local government in the state. And that is the reason why we are here. As media practitioners, we want to see your collaboration. How people that are sitting at home, how they will get to know about these diseases. We talk about NTDs. Àwọn àmì tí àwọn ọ̀pẹ̀rẹ̀ àṣìṣọ́ tí wọ́n ṣe jàmbá bí wọ́n ṣe jàmbá fún àwọn ọmọ wa not only fún àwọn ọmọ wa fún àgbàlagbà kan pàápàá so a ti wo àwọn àrùn yẹn a sọ̀rọ̀ nípa àtọ̀sí ajá kéèyàn máa tọ̀ kéèyàn máa wà bẹ́ẹ̀ tó bá yàtọ̀ kéèyàn máa wà bẹ́ẹ̀ àrùn inú ẹ máa rẹ́ lómi ipò ẹ̀ tó bẹ̀rẹ̀ kéré ni ẹ máa rò pé ó ti jẹun yóò jù ní àrùn ló wà bẹ́ẹ̀ ló máa jẹun wọ́n lè fẹ́ pé káàtì nígbà ló jẹun oúnjẹ tó jẹ yẹn kò yọ lára ẹ̀ oúnjẹ tó jẹ́ nutrient àrùn ló ń gbà bọ̀ ìjọba ìpínlẹ̀ Ògùn náà sì wọ́n ti ṣetán pẹ̀lú àwọn tó ń support wọn láti máa láti fún wọn dé Ògùn ní àwọn ìjọba ìbílẹ̀ mẹ́wàá tí a ti dárúkọ yẹn ìtúrẹ̀ láti wá gòkè we know as a media practitioners we want to seek a wider coverage so that kátó dé local government yẹn kan wọ́n á ti gbọ́ pé ìjọba ìpínlẹ̀ Ògùn wọ́n ti dé Ògùn tí wọ́n máa ń gbà yẹn because àṣẹṣẹ ń pin Ògùn tí wọ́n máa ń gbà yẹn wọ́n ti dé fún ìlera wa ni ní ọjọ́ Monday my director was say I said something that I pick only àsìkò náà why it's not the time to fall sick because of a lot of things that is happening and tábàárí àǹfààní tíjọba tó máa gbé tó gbé kalẹ̀ as a community or as a citizen yẹ ká embrace it and that is the reason why we are here so I want to count on you for mass sensitization of our populace so kótó ní bí a máa ṣe vote of thanks. I know that during the course of the program, as you go up, maybe this is the way I can learn. So, although we feel it, but that's not a lot. Artists of the hour, artists of what you are teaching, artists of what you are teaching, but they are need away that teaching. So, I want to let favor our one. So, the activity is started tomorrow with the stakeholders meeting across all the technology that has been mentioned. The technology I will mention them are Iwekoro, Ijebu East, Ijebu North, Ikene, Imeko Afo, Odeda, Oguota Side, Remo North, Yewa North, and Yewa South. What are you going to do for us? What are the commitments? What can we do for us? On Monday, when we had a meeting with our stakeholders across the various zones, the education is to help the NAPS. In fact, they also promised that yes, they have a larger meeting where all the providers will be there and they have invited the state to come and speak to them and we have taken that as an opportunity. So, as a media practitioners, how can you help us so that those people that are sitting at home, they will know that the same government has come again for the health of our people. So, we want to take our commitments before we run it up. Thank you very much. Thank you very much to our time.
Atirama.
Yes, sir.
Let's start from you.
Okay, well, I'm coming, sir.
Okay.
Okay, what our contribution is going to be, Abi?
Yes.
Okay. We are quite a diagonation of it. Lẹ́yìn tó ń túmọ̀ sí wípé abáṣekú bá ṣe ń ṣe náà láṣẹ máa ṣe ààrẹ láti fi kankan kún. Normal bá ti ṣe máa ń gbìyànjú kẹ́yìn tó wá táwa ti máa ń ṣe láti ṣe ìpolongo fún àwọn aráàlú pé láìpẹ́ láì jìnnà àwọn ikọ̀ evidence action ìjọba ìpínlẹ̀ Ògùn pẹ̀lú ìjọba àpapọ̀ ní ìkọ̀wọ́nkọ̀wọ́ wọ́n máa bẹ̀rẹ̀ sí ní jáde àwa ti máa fún rẹ̀ sílẹ̀ fún yín kẹ́yìn tó dé tí Ọlọ́run bá ní kí ìgbàláyé wà àti ṣe máa ń ṣe tẹ́lẹ̀ náà ẹ wà lẹ́yìn fún ara yín láti wá sọ fún aráàlú pé bíbáyìí la bá ṣe dé bíbáyìí là ń lọ o ibi báyìí ni kí ẹ̀yin ti gbà láti ràn wá lọ́wọ́ a jẹ́ ipa táwa lè kó ní àkàtà tiwa ní ẹ ṣé.
Thank you very much. Àgbàdo láti pàtẹ́wọ́ fún. Thank you.
That 1 trillion. Now, like tomorrow, which is the Friday, next is an hour. Of course, we have a space at home. Monday, Tuesday, upper week might not be. Then anytime from 22nd, which is Monday, Wednesday, 22nd, that is when the implementation is starting. When the moment will be starting. For that Wednesday, Thursday, Friday, it will be very busy for any of us because we'll be on the field. Yes, I know. Because we'll be on the field monitoring the activities. So that 22nd, 23rd, 24th might not be. But before then, of course, apart from our the training where you have to come amateur training, so thank you very much.
Thank you so much, sir. I would like to add this to my explanation. Àwọn ọmọ táwọn sọ̀rọ̀ nípa àwọn òkú táwọn sọ̀rọ̀ fún ọmọ tèmi kì í ṣe pàtó lọ fún ọmọ aláta. So that's the kind of thing we are doing it for ourselves. Ara wa náà là ń ṣe fún ẹni tó bá ní kí ìlú dára ó ní ọkọ tó máa gbé bẹ̀. So ó já sí wípé agbọ́dọ̀ ní sẹ́yìn kéde pé ọmọ mi ló máa kàn án fẹ́ fún lóògùn yẹn ó dẹ̀ máa jẹ́ kí mi náà sùn dáadáa nílé nígbà tó ní bá lálàáfíà. Now we can make some of our oil personalities as an ambassador to this great arrangement. Tí ní Alárẹ̀ FM, Alárẹ̀ FM, that is 88.3. That is the only Ìjẹ̀bú speaking radio tó jẹ́ pé wọ́n kì í sọ nǹkan bí Ìjẹ̀bú nìkan máa sọ 100%. Nínú àwọn ìyá wa tí wọ́n jókòó yìí. Now, tí wàá bá wà bẹ́ẹ̀, wọ́n mú ọgbọ́n sí báwọn èèyàn sọ̀rọ̀ bẹ́ẹ̀ ní ìwọ̀nba tírèdì kẹ́ bá fún wa lórí platform wa àbí bá a ṣe wáyé tó kẹ́ bá fún wa tí àyè bá ti wà fẹ́ há táwọn bá sọ ní 30% tá a bá rí online interview ó yẹ wà ní Ṣàgámù lọ́wọ́. Alága afẹ́fẹ́ sọ̀rọ̀ lórí ètò wa sẹ́ni fún wa ní sẹ́ni bá rọ̀ kẹ̀dẹ̀ bọ́ sí ìgbà tó bá kú kẹ̀dẹ̀ fún káwa ló báyìí la máa ṣe báyìí ló ṣe rí àwa níbi báyìí lọ́wọ́lọ́wọ́ online interview ó wà fún wa ní grace. Then káwọn èèyàn kàn wá mọ̀ yìí gẹ́gẹ́ bá yẹn sí ó lè má jẹ́ mi ló máa jẹ́ ní Lion FM ó lè jẹ́ mi ní Igbo FM ó lè jẹ́ mi ní Super FM ní SMB FM ní God FM àti bẹ́ẹ̀ bẹ́ẹ̀ lọ tó ká máa ní àwọn ambassadors wa in fact ó jẹ́ just other singlet and face cap ló kárí logo wa àtòrúkọ wa àtòdà àtàlà níbi ìyẹn náà àyẹ̀rẹ̀ báyìí so ó máa rẹ̀ sẹ́tọ̀ á lè lọ bí àtàlẹ́ kí n pè jẹ́ nígbà táwọn bá ti lórí platform láti àwọn nọ́mbà tó wà bẹ́ẹ̀ àjẹ́kẹ́ pé lọ sábàgà wọn wà fi níbà at least 3 numbers tó máa wà standby láti call ní any critical time táwọn yẹn bá ní the questions. Sometimes a lè record our voice ẹ̀yìn tẹ́ dọ́gà wa ká record voice ní tó máa jẹ́ bí 2 minute 3 minute package tàbí ẹni ká tó lẹ́nu àwọn aládé ìwúra wọn a lè máa release ẹ̀ sílẹ̀. But ẹ má gbé ìpolówó gbẹ̀yìn wa lọ ó sì kó káàkiri jù. Ìpàdé kan sábà ní àgbo ìpolówó ní Ìjẹ̀bú-Òde ní 2010 mo rántí dáadáa I work for one local candidate lóyà 2007 I think 2007 àdèbàdì ṣe pàpàpàtà èmi ni mo sẹ́ẹ̀tì from day one to bí pàpàpàtà wọ́n dẹ̀ ní bá kí ni àti wọlé o lọ́wọ́ ṣe kú sí wọ́n kọ́ lọ́kọ́ ló sá program wa ẹ̀sà ẹ̀ má fún mi má pè mí sọ́fíìsì mi kí ni kàn máa programmate iṣẹ́ tẹ̀yìn bá ṣe àbẹ̀ tí a máa fẹ́ lọ sí lọ́wọ́ olókè adé o ọ̀la náà lọ ẹ̀yà kí ni sọ́rí tòmí lọ́la wọn fẹ́ lọ kólẹ̀ níbi láyé o mo fẹ́ sọ fún yín pé mo ń gbọ́ program yẹn lórí ìgbà tí mo sọ yẹn kò sí sí rédíò díẹ̀ o program proposal ní ilé yìí láti lọ́ba tí káwa ní pàákì ni nígbà yẹn náà ní ti dàgbà tó bá ti bá dàgbà tó bá ti lè wò torí máa gbé wọn jẹ o wọn lè fọwọ́ lọ mí ẹni mi ò ní gbà ṣùgbọ́n nígbà yẹn ó ti tẹ̀ wò dà so now ẹni ká lọ pé ajọ ń ṣe ká bá ṣe kí ṣe pé dandan ni kí afáàtì wa o tó lè padà wá tójú ayẹ jù ẹ má dẹ̀ ká lè post ní lórí o ẹ má lè post ní lórí náà àwọn tó máa dọ́gba ní olè pọ̀ ń bẹ̀ o àti wà pọ̀ ń bẹ̀ tẹ̀ láti mú kòkè àwọn alọ́lá tẹ̀ mú wálé dáadáa tẹ̀ mú ẹ̀sìn mọ́ fi tẹ̀ mú ọmọ dáadáa àwọn tó bá kú ọ̀rẹ́ mi náà wà jẹ́.
Thank you very much, sir. Well done, sir.
I want to say.
Yeah, our guys any kind of guy.
I just want to conclude everything that help us to learn.
Ẹ jọ̀ọ́ ẹ jẹ́ kí n sáré sọ nǹkan tó ti wà lọ́kàn mi látẹ̀kan nítorí mo rántí pé tẹ́lẹ̀tẹ́lẹ̀ nígbà tí Mr. Kazeem àbí tí wọ́n máa ń bí Mr. MC ṣe sọ pé wọ́n máa gba proposal and the likes nígbà míì owó tí ní sílẹ̀ tí mi bá gbàgbé wọ́n á ní go and do it mo dẹ̀ fi gbogbo àwọn tó wà lórí ìjókòó ìyàbẹ̀ tí station ò bá síbẹ̀ nìkan ni mo máa ń gbéṣẹ́ through ẹ̀ even despite the fact pé mo mọ̀ wípé mo mọ ẹni tí mo lè lọ bá rédíò Mr. MC lójókòó yìí tíṣẹ́ bá bọ́ sí tébù tèmi o Mr. MC gba máìkì. No.
Mr. MC ṣọ́ máa ń gbéṣẹ́ fún yín.
She just said it. Of course, she's my sister.
Okay.
Because you know why? Reason is this for see anybody me Fàájì FM ọ̀gá gbogbo ni máa ń gbé fún ṣẹlẹ̀ ọgbà nọ́mbà bọ̀bọ̀ yẹn sí báyìí tá a mọ̀ tí iṣẹ́ bá dé sọ́dọ̀ mi màá lè pè pé iṣẹ́ tá a ṣe ń jọ sí gbà. Ìdí ni wípé mo understand kí èèyàn wá jókòó síbí kó wá pàpọ̀ iṣẹ́ yẹn ò yí ẹ̀ àkúdà. Kẹ́ni ẹ má ní 50 kọ̀bọ̀ lórí bọ́ iyì pé mo múṣẹ́ wọlé wọn kí wọ́n máa sọ fún mi sí Spanish ẹ̀ pé nígbà ní àbí orí owó lórí iṣẹ́ yẹn bó yí pé amúṣẹ́ wọ radio station wà ń bẹ̀. Tá a bá fẹ́ fún yín ní appearance ó máa ń jẹ́ wa lára láti pé ẹ máa bọ̀. So ẹjọ́ tó ní tọ́ lọ́run ìdí tí mo ṣe tètè clear waves yẹn rèé mo ti parọ́ kan fún mi mo ní nígbà mi wọ̀n kí n fowó tì í wọ́n á ní go and do it the later pay me ní ìgbà mi mo lọ gba owó níbì kan láti fi ṣe so radio station gbogbo radio station kọ́ ló lè gbà yẹn but as my own field and profession mo ti mọ̀ pé àwọn iṣẹ́ kan àti jẹ́ pé o máa bá wọn ṣe tó bá ṣe tán tó bá di pé o ṣiṣẹ́ yẹn ó pé another to do rèé àwọn míì tẹ́yìn gbéṣẹ́ fún yẹn ò ṣiṣẹ́ pé mi jẹ́ pẹ̀lẹ́ nìkan pè mí pé kí màá bá wọn mọ́nítọ̀ ẹ̀ṣẹ̀ mo ní iṣẹ́ ìwà òkè iṣẹ́ tí mi ò gbowó ẹ má fi orú ẹ̀ lọ mi mọ́ ó ní alájẹ ti bí mo ní mo bínú o tó ní mi ní sọ̀rọ̀ yàn lẹ́yìn ẹlòmíì máa gbaṣẹ́ lọ́wọ́ yín ẹ mọ̀ pé 37 naira la pé òun wá ní mú 650 wá ẹ lọ wò ṣẹṣẹ yẹn pé ẹ lọ wò ṣébi tó yẹ kó ti lọ ti lò ó bọ́lá òun ní bá ṣe wa jẹ́ o.
Ẹ ṣe Ọlọ́run kún ọ lọ́wọ́.
Àmì Ọlọ́run.
Gbogbo ẹ̀yin tẹ́ bá nífẹ̀ẹ́ mi nìyẹn máa fàdúrà ràn mí lọ́wọ́ kọ́lọ́n kó fún wa ṣe. Àwọn tó mọ̀ mí dáadáa tí wọ́n bá mọ̀ mí fún gbogbo kan fún ọ̀yọ̀ kan pé mi kì í fẹ́ bọ́ chíìtì mi dẹ̀ kí n fẹ́ kí wọ́n fi ẹ̀tọ́ èèyàn kí wọ́n fi lò. So mo fi ń dá wa lójú níbí báyìí lé this is a promise this is a pledge tí mo dẹ̀ mọ̀ pé ó ti di àmọ́ náà sí mi lọ́rùn láti pè kọ́lọ́n kó ràn mí lọ́wọ́ so whatever I can do and I also communicate our back here so this one I come and report on to the state coordinator so táwọn náà bá tún bá wa fi tó àwọn tó tún jẹ́ ọ̀gá wa létí àwọn bitaris tó jẹ́ kó tó kù díẹ̀ kó àwọn bí kùdìẹ̀kùdìẹ̀ yẹn a máa ṣe ìgbìyànjú lé lórí kọ́nà wà lọ́wọ́. Bọ̀ǹkọ́ ẹyọkọ tí wọ́n á fẹ́ ní síìtì ìta wà yìí òun ni wípé bí àwọn èèyàn wa sófà sórí mo ṣe mọ̀ ọ́ tó jẹ́ fọ́ńdà wa bí wọ́n ṣe máa ń ṣe ni wípé wọ́n á ní ká mú 3 quotations wá 3 quotations wọn ò ní sọ pé kí lion mú wá lọ́tọ̀ kí fàájì mú wá lọ́tọ̀ kí gbogbo àwọn radio stations ẹni kọ̀ọ̀kan ẹni kan wá lọ́tọ̀ so 3 quotations wọ́n máa ń béèrè bọ́bí ìmọ̀ bóyá ó wà appropriate àgbẹ̀lẹ̀ ìgbà mi láàyè láàrin ara wa mi báyìí ṣáàlè yan representative talented fẹ́ kamalayas pẹ̀lú Mr. Ajara Malefa la máa ń layas pẹ̀lú dáadáa torí àwọn la mọ̀ in fact àwọn ní.
Why would you want to? You have our phone numbers now. Couldn't you reach out to her directly?
Ìdí tí mo ṣe ń béèrè náà nìyẹn bọ̀ ẹ má gbàgbé pé mo sọ síwájú pé quotations mẹ́ta ni wọ́n máa ń béèrè tí bá ní shout pẹ̀lú yín ṣé màá lè sọ pé kẹ́ fún mi ní invoice tá a máa present fún àwọn funder wa.
Mr. Kazeem has been doing that with me.
Tẹ́ máa fún wọn ní invoice. He might be doing it with you but he has no right to present an invoice from your end and present from another person. As partner pays to you directly, ṣé partner ti sanwó fún yín directly?
Yeah, they pay to my no. What I use my media outfit and they pay to it and they pay with receipt and they have their receipt.
Okay, wọ́n máa sanwó fẹ̀yìn, máa sanwó fún
Not me. I have my own media outfit as well.
Okay.
So it's like media organization. That is what they want to see. And they want it from OGBs, why not? Provide it.
Okay, no problem. Does anyone want to contribute to this? Do we go in line with that we communicate with you individually, or we have a representative amongst you that will liaise with you? You tell her the amount or the price that you want to, or is it that our láti wà playing juju? Actually, issues like this, I don't usually put my interest in it. I prefer the technical aspects. She is the officer in charge of the social mobilization in the unit. So àwọn la máa ní pé kí wọ́n láyà sí láwọn mídíà wa. Kò torí pé Ájàrà Màlífà la rójú wọn jù.
We have Rama.
Àwọn la rójú wọn jù.
How is our person? You don't think
Sir?
It's okay.
Okay, that's fine.
Nǹkan tí mo realize ni pé kí ṣe giving out quotation is the issue we are talking about. Reaching out to you people, giving you our gift, how to produce give you events. But that reach out to you individually. Okay, give us your schedule. We want to hear this jingle like so times in your radio station. In here, the wrong way we can communicate directly to you so that we have your contact. Are you getting it? But yeah, okay, jingle yẹn ti wà produced. Our company jingle yẹn, ẹ̀yà dẹ̀ fún wa ní schedule time. Then ìjọba wà yẹ. Ìyẹn mo rò pé we can actually communicate to you directly.
Yes.
Do you get it? Yes. Nǹkan tẹ́lẹ̀ ìwé kò ṣẹlẹ̀.
But another any way you want it, it's okay with us. Just don't let us be.
The most important thing is that gbogbo wa ta wà ń bí gbogbo àwa ta ní lórí platform wa is that we have realized that the best bet for us is to engage every one of you. Kọ́nà wà lọ́wọ́. Mo sọ ẹ́ ní alẹ́ ẹ̀kọ́ yẹn pé àwọn bùdá ti ní cross training pé partner will just come and give us 6 radio stations. Give us unicorn radio stations. So from Abuja, mo ti sọ kí bàkìrí tó dé, àwa sọ fún ọpá wò ní lójú wọn tí wọ́n lọ produce wa. Torí kò tiẹ̀ lọ pẹ̀lú what is it called wa culture ti wá ń bí báyìí. Ẹjọ́ sà kí ló ń jẹ́ ìjò inú? Kò sí. Kí ló ń jẹ́ ìwọ́nú? Àrùn inú ni nǹkan táwa mọ̀. Àwọn dẹ̀ lọ ń gbé ìjò inú wá fún wa. Kí tiẹ̀ ló fẹ́ fi sọ lójú ọ̀gá?
Kékeré ló máa ní ọmọ tó ẹ̀sẹ̀ bí ló ní ìwọ̀ inú níbi ìwọ̀ tí ó kàn bá jó dáadáa.
So and that is the more reason.
A day and 40 days.
That is the more reason that we need to incorporate those that are professionals in the field. Ṣé báwo lè mi practice lẹ́ẹ̀kan? Ní mo practice bá ṣe ṣe jígù kéré o mi wọ́n sọ. Torí kò ṣiṣẹ́ ilé tí mo lè tí mo sọ. Èyí tó jẹ́ pé ìkọ́tẹ́yìn lọ fún nìyẹn. Tí wọ́n máa ní bàbá gbọ́n sàfẹ́fẹ́ tí ó máa dàgbé gbà tó jẹ́ pé lóyìnbó ló ti lọ́kọ́ ni. Ọlọ́run àlọ́.
Thank you very much. The Senate has been a very productive interactive section. I want to appreciate you for taking out your time to be here. And we are not taking for granted. So all the feedback about what you had to saw, all the feedback has been taken, and as my boss have said, we'll work on them. So I want to thank you once again. Bá a ṣe fi àwọn iṣẹ́ wa sílẹ̀ táwa jẹ wa ọlọ́wọ́ ìlú wa sílẹ̀ iṣẹ́ wa á tún wà gbèrú sí iṣẹ́ tá à ń ṣe a ò ní bàjẹ́ níbẹ̀ lórúkọ Jésù. We want to appreciate on behalf of the state entity coordinator. She was earlier here, so she has led to attend to other things. So we want to say thank you. Dúpẹ́ àpọ̀lórí. So Adélébárí Àrìnàkúnlé Àkóyáìbí. Thank you very much. So we want to take before we take the closing prayer, I want to take a group photograph. So we use this background to take a group photograph. Or let's take a closing prayer, then we'll take a group photograph.
Okay, sir. Ẹ ṣe prayer.
Alhamdulillah.
Alhamdulillah. Alhamdulillah.
Ọba tó kìlọ̀ ọ̀pẹ́ sọ́nù mi. Ọlọ́run sì ọ̀pẹ́ kan ní físíkù. Ó sì lè kejì ní físíkù. Físíkù ọ̀pẹ́ ni pé àyíra wa báyìí. Àwọn òkè ìgbéga àti wọn. Físíkù ọ̀pẹ́ ni pé àwọn ìnáwó àpẹẹrẹ tọ́lọ̀ ń ṣe fún mi pẹ̀lú. Tí àwọn bá wà wọn, ó wá ní ìsìnkú ọ̀rẹ́ ó wá lọ sí ìtù. Òun nìkan ní ọ̀kọ̀ọ̀kọ̀. Àwọn ọ̀rẹ́ tí ìmọ̀ ní físíkù. Ẹni ọ̀pẹ́ àti àwọn elétò wa ọlọ́mọdé àìlámù àkáyé ìwọ̀lọ́ mọ́ta ní látòrí gómìnà wa igbákejì àti gbogbo ọmọ ìpínlẹ̀ Ògùn májèlé arábò ààrẹ wa àti gbogbo igbákejì àti gbogbo ọmọ Nàìjíríà májèlé arábò lọ òtútù tó wọn lè ṣe sọ lábàá pàdé kájẹ́rì sí agbára lọ láàkàwọ̀lá lọ́dà àkùrọ̀sà ìlà àbẹ̀là àlẹ́
Thank you very much. So, once again,